You are live.
Okay, good morning, everybody. Welcome to our special meeting of Las Cruces City Council. Today is Friday, October 30th, 2020. It's approximately 9 a.m. Before we begin, if you please join me in the Pledge of Allegiance. Pledge of Allegiance to
the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Okay. Let's see here now. We just have we have a conflict of interest statement we need to ask. So just want to ask if there's any member of the city council, city manager, staff, or member of that has any conflict of interest on any item on the agenda.
None.
Mayor.
Yes. Who said? Oh, someone said something. Okay, so the first item is resolution 21-067. Need a motion and a second, please.
Move to approve.
Second, Gambetta.
A motion made by Councilor Vasquez, second by Mayor Pro Tem Gondara. And let's see who's going to be discussing. Maybe legal, I presume. Is Jennifer here? Okay. Well, if not, I'll go ahead and take it. So basically what I did a few days ago, as you all know, was in response to the increase in COVID cases. And I had earlier that morning, had discussions with the mayor of El Paso and the county judge of El Paso, as well as the consul general and representatives of Mayor Cavada of Juarez team. And so, you know, one of the things that we were discussing is if we could somehow have everyone wear a mask, that would be the ideal situation. You know, we recognize that that's not possible, and so the next best thing is, in my opinion, was how do I focus on mask wearing outside? And so I'm sure many of you have received different reports throughout the months about how people at, whether it's at the skate park or whether it's at the farmer's market, although there's a good amount of compliance, it's not 100%. It's not, you know, and I feel that some of those venues, if we focus on it, we could have near 100%, theoretically. We should have 100%, just like City Hall when we, and I appreciate your support, when we required that anyone entering City Hall has to have a mask. If you don't have a mask, you know, we have one available. And if you don't have one, then you can't come in. And so what I wanted to do was do a 7-day restriction on indoor recreational facilities. And I guess I was thinking more of, say, Mearshite Center. The Aquatic Center, we haven't had any situations there. And I don't know if the chlorine helps. I have no idea, but we've never had any problems there at the Aquatic Center. And so what this resolution will do is take us about 4 more days, and then it expires, in essence, is what it does. And then we could reevaluate it then. I know there's going to be another discussion.
Please leave a message at the tone.
I know there's going to be another message. There's going to be another part of the meeting after this. And so that's kind of where we're at.
The district health officer in Las Cruces is on the phone. Please leave a message at the tone or enter another extension.
Yeah, I believe that's David Dollahan, if he can mute himself.
Oh, is that David? Okay, so kind of that's where we're at. So open up the floor if you guys have any questions. Basically, all this does is extend it for 4 more days, because mine can only last for 3 days.
Mr. Mayor?
Yes, Councilor Flores.
Yes, for some reason I have sound, but that's about it. I thought your proclamation was to have that it would be in effect until further notice from the governor or further directive from the governor. Did I read that?
No, it always starts off like that. That's why we first did this resolution, giving me this authority, and then basically now if the governor ends the the emergency order, then this automatically ends.
Oh, I see. I thought that it would be, this particular one would run through the end, but okay.
Oh, no, 4 more days. Councilor Vasquez and Councilor Bencomo.
Thank you, Mayor. Yeah, I'm glad to see you're having conversations with some of the city leaders here in our surrounding communities. I saw yesterday that El Paso County Judge Samaniego, I believe, is trying to, or has essentially ordered a shutdown of all non-essential businesses for 2 weeks, and he's in a little bit of a legal fight with the state of Texas, with the Attorney General's office and their governor. And I know we've thought about the connectivity in the past between our two communities, really our entire borderland community here. And when we had more strict measures in place in Las Cruces, I think folks were saying they're going to go down to El Paso, right, to shop or to do the things that they can't do in New Mexico. And so I don't know if you've had conversations or have given thought to the opposite happening, in that if El Paso is completely shut down and we remain open, that we're going to get a lot of El Paso folks coming to Las Cruces, which during any other time, I'm sure we would welcome their visit and their GRT dollars. But is that something that you've discussed with city leaders from El Paso or from Juarez? Is just the difference in policies over the next 2 weeks and what that means for Las Cruces?
Right. No, that's a good point you bring up. And so in thinking about it, we did discuss it. In fact, I think it actually, during that conversation, it was discussed that many of the residents coming from Juarez and crossing into the bridge, not all of them are wearing masks. And I asked Mayor Margo, is that a requirement that they have to have it in El Paso? And he says, yes. And I'm not one to try to tell them what to do. I just had suggested, I said, well, I wonder if it'd be good if you have your codes, your people there, right, as they're coming off the bridge, and these, here's a mask. That's all, that's where it was left. So I guess what I'm trying to say is, and if you think about it, if we had influx of people, and of course, this is going to be for non-essential services, of course. But if they were here and they were all wearing masks, I think that's the whole key, really. When you get right down to it, when you step back from everything, if everyone wore a mask, I think that's where it all started. I think, and I'm sure you all have seen the reports. I think it's just the months that have gone on, and people are just maybe they're thinking, okay, vaccines around the corner. It's time, they're letting the foot off the gas. I don't know, but interestingly, it's throughout the whole United States. It's not just us. Now, granted, our area is experiencing huge spikes, but I think the just general mood of the public is that, things are good and they get together, and next thing you know, the spread takes off again. And so I think it's just a matter of really cracking down on wearing a mask.
Yeah, thank you, Mayor. To speak personally for that situation on the border, I have crossed the border walking several times from Ciudad Juarez to El Paso, and you cannot cross the border without wearing a mask. CBP will not let you even be inspected or show any type of identification without a mask. And right now, currently, Mexican nationals are not allowed in the United States. You have to be a U.S. citizen to be able to cross the border as a pedestrian. So there's not even any way that any Mexican national with a tourist visa can even get across the border with a mask or not. So I just want to make sure we clear up those comments, because I think it puts undue blame on Mexican people who can't even legally cross over right now at all because of the Trump administration's directive to shut down the border. So these are all U.S. citizens that are flowing back and forth between the port. I know this because my family can't cross over, who are Mexican nationals, and that ban has been extended till the end of the year. So those are just two quick things to clear up. I think the problem we're having is just with a lot of our own folks here domestically that are, like you said, refusing to wear a mask for political reasons, or, just whatever type of COVID fatigue folks might be having, which it's unfortunate because we're seeing the highest numbers that we have, right? I mean, I think we were taking this even as a government, at least paying a lot more attention to it when we had lower numbers and talking about other measures that we could take that I know seem pretty drastic to the public. But now that we're seeing the highest numbers ever, I think our decisions should be reflective of that. And so I want to thank you for your emergency proclamation, Mayor. But also really start thinking about what you said in terms of the mask wearing is what type of enforcement power do we have and how aggressive can we be? Because at some point, every life that we can save as our hospitals are getting overfilled, people are getting, I think, flown out of El Paso now because the hospitals there are to the max, are just packed to the brim. And there was a letter, I think, from healthcare professionals, even just urging people to stay home from El Paso. And so we're in really dire straits here. And I think if we were ever to consider the option of stepping up police enforcement, like real enforcement, not just, warnings, I'm talking like let's maybe put some teeth on this. I think now is the time. As you mentioned, it's out of control everywhere. And so I don't know if you thought about anything within your proclamation or extension of proclamation that might have a directive for LCPD to actually conduct some routine daily enforcement or how we could make sure that we do that, maybe not through this proclamation, but through consensus, working with our city manager. So yeah, Mayor, any thoughts on that, just in terms of the police?
No, that's a good point. In fact, I did. And keep in mind, and I know Jennifer's has her hand up, and I'll defer to her in just a second, but it's my understanding that I can't deviate on this proclamation. It's either up or down. But say the next one, let's say, I was thinking of, depending on, and this is a good forum to discuss, is maybe going to 250 of citation and us really doing this. I mean, I know we talked about that in the beginning about not wanting to cite them, but when you weigh the risks, I really don't want it. The curfew is like the last thing. But if we, I think it's kind of progressive. If we move in that direction, okay, this doesn't work, what I just did. Okay, now do we step it up and do we increase the fine and do we actually go out and find them and let people know we're serious. We need you to put a mask on. I do not want to do a curfew here. Please don't force us into this shutdown. We don't want that. I don't want that. And I don't think anyone wants that. But because it's really all about wearing the mask. It's like, please, for those that aren't wearing it, for the benefit of our rest of our families or the businesses, everybody, just wear a mask. Just wear a mask. It's just that simple. I mean, I know it's hard, but it's almost like you're running a mile race and it's 4 laps around the track and you've run 3 and you've done pretty good. It's like, I'm just gonna walk. You're almost there. We're almost there. Don't do that. Just keep it going. Just do it. That's kind of where I'm looking at it. If I could defer to Jennifer on that one question, like I said, I think I can't change this. I think it has to be either yes or no on this, and then maybe the next one I can do. Jennifer, did you had your hand up?
Thank you, Mayor. I'm sorry earlier my audio wasn't working, but you're correct. If you want to change the fine, it would have to be through another proclamation or another resolution. However, I just want to clarify that the extension of this proclamation, the extra 4 days would only be for the facility closures. Everything else remains in effect. So the requirement that people wear their mask in businesses, all of that remains in effect as to the earlier proclamations.
Oh, okay, good. Yeah, okay. Well, yeah, I was just wanting that 7-day on in our own facilities. That's what I was looking at. So I appreciate that clarification. Okay.
Thank you, Mayor. And thank you, Jennifer. I would absolutely support that. And I think really have to look at that in the next week or, sooner than later. I think it's unfortunate, but we really do have to make this consequential for people not to wear masks. And similarly for businesses, I know different stores have different policies about what they do when somebody enters their store without a mask and refuses to wear a mask. There are some stores whose policy it is to let that person continue shopping. without, essentially kicking that person out or taking measures to enforce the mask wearing because they fear that it would disrupt, I'm sure rightfully so, and could be a dangerous situation for other customers. But I think that's when that business has to step up and perhaps hire a security officer or some type of professional who is actually can handle a situation like that. But I think that's also incumbent upon letting our police department know and giving them direction to take these calls seriously when they do have reports of somebody that's not wearing a mask or refusing to wear a mask and is, I think that should be a priority for us, and we should be thinking about that the same way as we're saving lives in other situations. I don't know how true this is, like anything else that's on the internet. It's, always be skeptical of it, but I am hearing more and more that that the police aren't responding to these calls, or that they're simply saying, we don't enforce that, call the state police. It's their job to do this. And, obviously that's not probably the kind of service we want to provide our constituents. It's just to pass the buck to another law enforcement agency when we have the resources to enforce some of those things. And so, I think a combination of those things at businesses, really maybe directing business or even increasing fines for businesses that, encourages them to step up. And I'm mostly talking about the big box kind of type of businesses here. And then the personal fines as well for folks who are entering these businesses and refusing to wear masks for political reasons. They're putting other people in danger. It's not just about their own personal freedom. And so, in a future proclamation, I would absolutely support doing something like that. So,
Appreciate
thank you,
that.
Mayor. Yeah, thank you, Mayor. Those are all my comments for now.
Thank you. Councilor Bencomo?
Thank you, Mayor. Yes, I'm very glad we're having this conversation today, though I worry that that the current proclamation, frankly, doesn't have enough urgency to match the kind of numbers that we're seeing. Yesterday, 11 New Mexicans died is the single largest number since May in one day. And, I'm watching El Paso, and I'm watching El Paso take a pretty serious stand because they have to, right? Not because they want to, but watching them take pretty seriously, probably unpopular decisions for the protection of El Pasoans. And it's unfortunate, right, that those who refuse to believe that this is a serious virus, those who refuse to believe that masks can help curb the spread are ultimately the ones who, frankly, have landed us in this situation. And so it's unfortunate that I think our sister city is having to take some of these steps, but as I'm watching them step up, I'm wondering what we're doing. And I'm wondering as a city, what we're prepared to do as we're watching these, 200 numbers a day. And I'm personally really concerned about the health of this community. And I'm nervous that if we say today, I think we should take more serious measures, particularly around enforcement. I want to know when we're going to have that conversation. I want to know when we're actually going to vote on that, because I don't want this to be 2 weeks from now when things are terrible and we're saying, I wish we would have done this 2 weeks ago. I personally don't want to get to that point. And I would love to hear from our interim chief around enforcement, because I've also heard we cannot just allow the state police to be the only ones responsible for enforcing some of these requirements. And you're right, Mayor, a curfew would be, well, actually, I don't think that's the last, another shutdown is absolutely the last thing we want to see. A curfew is pretty darn close to that. And, for me, as I read and I research about what is leading to this surge, it is people not following the large groups requirement of more than 5, more than 10 people. That is number one. And then it spreads. The second is restaurants. And I just want to make really clear that for folks who want to continue to have non-essential business open, we have to follow it with enforcement. Like, this isn't just a honor system at this point, because the honor system hasn't worked. So for me today, I'd like to know, if it's not this proclamation, when can we see a proclamation that includes tougher enforcement measures on the table?
Oh, well, I know Jennifer wanted to say something, and I'll defer to the chief in just a moment, Counselor, but what I'm doing is I'm listening to your comments, and frankly, that's kind of where I'm going to go with that, or I'm going to take that all into consideration. The way I understand it, and Jennifer can correct me, it would be something like you said. It would take 2 weeks if the council wanted to do it. I think I'm allowed to do it a lot quicker. But again, I'm every day. I mean, I'm watching, I'm listening, and seeing what exactly could be the cause. I'm trying to find out, and I'm interested to see how it's going to work there in El Paso. I mean, if I don't know where the flow is, and I'm glad Councilor Vasquez clarified that. Interestingly, you would think, and you have the mayor of Cavada and his staff and the consul general on one side, and then you have El Paso on the other, and no one ever mentioned that those are just American citizens crossing in. Why didn't they say that? I would have liked to have heard that. But anyways, I am watching. I can't probably get too much into discussion because it's not on the agenda. It's just my proclamation is, but I am, obviously I'm taking note of what you all have to say.
Yeah, Mayor, I appreciate that, because I don't think we have 2 weeks. I don't think that's an option on the table.
Every day I watch it. Believe me, let me let Jennifer chime in a little bit on some of the things that my proclamation had intended. And if you recall, I had asked 25,000 to be pulled out to be used to accomplish that, whether we hire more security, use that for overtime, whatever it may be the case. Jennifer, you want to talk a little bit about that?
Mayor, thank you, Mayor and Council. In your proclamation, what is stated is that we can utilize the resources necessary. There's not an actual dollar amount. It's any resources. So we can do that right now. As far as enforcement goes, I will speak to Mr. Peely about this. There are many options. One of the options is to proceed on nuisance abatement. As part of your proclamation, it makes it an ordinance. And so the violation of the mask wearing in a business would be an ordinance violation, and we can proceed with code enforcement in that way. Of course, I would have to coordinate and talk to Chief Dominguez and Mr. Peely about that option. And that would be that's a civil option. That part of that is a civil option.
Okay, is Chief Dominguez on the call?
Mayor, can I say so? I'm sorry, I'm trying to look for the place I raised my hand. I can't find the.
Oh, okay, no problem.
There. Mayor and Council, and I just wanted to make a comment as well. I was going to say, I don't know if we need a proclamation to increase our enforcement. And before Chief jumps on, if that's the direction we want to go, it's just pulling them in and saying we need to enforce. We need to tighten that up, and so it's just direction is from the city manager. I mean, I'm sure Interim Chief Dominguez would be happy to oblige. I mean, I can understand maybe the confusion or maybe the being hesitant. We should be hesitant, right? But when we're having these numbers, this is a time we increase enforcement. But it is a time where for everyone in the country that it's a difficult thing. I know we all know, but as far as waiting for a proclamation to increase enforcement, I don't know if we need to. And if I'll meet with Jennifer. I appreciate Jennifer bringing up some options we have, but that can be done immediately. In fact, we could just say, even in a public meeting, that direction is going to come to our police that we're going to increase enforcement, and we're going to actually fine. I know we've talked about it, but we're going to do it. I mean, I'll say that in a public meeting coming from the city manager. And I'm sure the police, it's not it's not an easy thing to do, but I mean, if that's the direction we want to go, I'm sure the police department will will oblige to that. So that's all.
Yeah, no, I appreciate that, Ifo. I think, and Jennifer, correct me, and this was this preceded your time. I think the maximum fine we put was either $75 or $100. And I think what I was talking in conversation with Councilor Vasquez is if we wanted to bump it to $250, I think I would have to do the proclamation for that to bump that up. But I'll defer to Jennifer. I thought it was $75 or $100. It wasn't anything huge because at that time, you know, it wasn't. I emailed someone the other day, and I remember doing a video, and I was saying about, hey, don't go to El Paso. They just had 30 cases confirmed, 30. The other day they had 1,450. So you know what I mean. So back then it was a little bit different time. You know, we were hesitant about finding anybody, but you know, what I don't want to do is I don't want to put this forth to everybody when there's just certain bad actors that aren't wearing a mask, you know, and we're having to punish everybody for these. And so we'll just go after those. That's the way I look at it. But I appreciate that, Ifo, really do. Jennifer, do you remember the price, the fee, the fine on when we passed this, what the amount was?
Mayor and Council, I was just trying to verify. I was looking up the previous proclamation. I believe it was $50 for an individual. And I think it was different for the business. I'll verify that and get back to you.
I think it was pretty small. And I think the maximum for the business, I think it was something like that. 50 per, if we find, you know, three customers shopping, then the business gets fined, you know, up to $500 max. Well, yeah, we may want to increase that. So, okay, Chief Dominguez, are you available? Did you have anything you'd like to say?
Good morning, Mayor, and everyone else. I'll assure you that the LCPD is taking this seriously. We've educated all our officers, and we do not defer to other agencies. I know there's been a couple of complaints, but we've been unable to we've looked into them, and we've been unable to find who it was that they were complaining about and the like. That being said, we've taken a proactive approach. We have teams going out to the businesses, going into the larger box stores and checking for compliance. We're doing it as a proactive approach. I will say that if we do start citing everybody that we see without masks, it's going to be a daunting task for our entire force. We had the issues with the skate park, for example. We show up, as soon as we show up, everybody puts a mask on. They produce one or we supply them. But as soon as we drive off, we hear complaints that, you know, they took their masks right off, and that's the problem. So we can do it. It's just like another, like speeding, for example. If we're around people, don't speed, but the minute we are not in the area, they speed. We can do it. We can do it as a no tolerance deal, but it is a daunting task, and it's going to expose our officers as well to more contacts as well. And I will point out that our officers and some of our personnel here have also tested positive. So it's a dangerous thing, but we are taking it seriously.
Okay. All right. Thank you, Chief. Okay. So
can I just add something here?
Sure.
Yeah, sorry, I wanted to add a couple more things, if that's okay. And then I will just say, right, Chief, that I think I hear you. Like it's tough when someone doesn't want to take personal responsibility. Like that's tough, right? And I will say, to your speeding analogy, I haven't sped since last time I got a $250 ticket. So I will just leave that on the table, because I did get a ticket that was very expensive. And
you had to have been going pretty fast.
Mayor, it was an issue. And you know what? I got cited, and trust me, that is something I took very seriously in my life. I was like, I have a problem, and I should probably stop driving like that. My point, though, is that if we're just telling people, hey, please wear your mask, and aren't following it up with enforcement, then people will just continue to do their same behavior. I also want to add, in terms, I don't at this point. Oh, sorry. Go ahead, Mayor.
Hey, Councilor, and let me tell you something, and this is good, because remember, if we go back a few months, council was a little bit hesitant to do this. So I'm glad to see that, we recognize the importance of it, and it's good to hear you, supporting it.
I wasn't hesitant a few months ago. So I just want to point that out. I also am curious, I was trying to look for the most recent public health orders. Jennifer or Mayor, what is the current capacity for some of the big box stores for how many customers they can have inside?
Well, that's a good point. I don't know if it's, I don't know. I couldn't tell you. I didn't even know that they put that. I knew they had the limitation on restaurants.
Well, if we don't, I think it's something, frankly, that we should look at as well.
What? Someone. Oh, I was going to say someone, right? Yes.
I'm going to turn off my audio and video, and I'll look up the current public health order and pull it up on my screen when we get it. Okay. I think it's 25%, but let me get back with the council. Okay. Thank you.
Okay, that was David Dallahan speaking. Thank you, David. And no, that's a good point. Yes, Councilor Flores.
Yes. Forgive me for interrupting or barging in like this, but as I sent you that text saying that I have no video, I just have the audio. So thank you, Mr. Mayor. Yeah, I know that Walgreens has a 40 people are only allowed at a time, and that's a Walgreens on Loman and Roadrunner Parkway. So stores are aware of what the capacities are, and I think it's per square feet, but I guess David will get that information. But I also, along with Councilor Bencomo, want to go on the record as saying that, in fact, I think we were still meeting in chambers when I proposed that we have a curfew, and that wasn't really appreciated, or people didn't feel, fellow councilors didn't feel it was necessary. And I proposed that we have a $500 fine, and people didn't like that. And I was saying we could be civil, not criminal liability, but I don't know how it would play out. The way things are going right now, I know that in some countries, and this is based on, this is just based on what I've seen and heard, is that police are actually enforcing, and they have cameras on people, and then they broadcast it. So, and apparently it's a little, I don't know what's going to get us out of the surge we're in right now. It's just, apparently it was a Labor Day weekend that really set this off. So that's all I want to add at this time. But I do think that I hope we get those numbers from David soon, and then the clarification from Attorney Vega Brown. But it seems that we definitely need to put some teeth in this, and we need to do something that is a little bit more proactive. Thank you, Mr. Mayor.
Okay, well, back to Councilor Bencomo, and then we have a Councilor Betestuvi and the Mayor Pro Tem. So Councilor Bencomo,
Mr. Mayor.
Yes, David.
David Dallahan for the record. I'm prepared to share my screen with the language from the current public health order.
Please, if you don't mind, Councilor Bencomo.
No, please.
Mr. Mayor, David Dallahan for the record. I'll read this. This is from the public health order issued last week by interim Department of Health Secretary Billy J. Jimenez, and it relates to essential businesses, which includes grocery stores. And it reads, for the record, item 2, he hereby directs, item 2, essential businesses may open but must comply with the pertinent COVID safe practices sections of the All Together New Mexico COVID safe practices for individuals and employees, and any identified occupancy restrictions. Essential businesses identified as a retail space must be closed by 10 p.m. and remain closed until at least 4 a.m. A retail space may not exceed 25% of the maximum occupancy of any enclosed space on the business's premises as determined by the relevant fire marshal or fire department. Further, any identified essential business identified as a retail space may not allow a person who is without a mask or multi-layer cloth face covering to enter the premises except for the person in possession of a written exemption from a healthcare provider. And then also item 3, the close contact businesses list 25% maximum occupancy. And I can tell you that I am aware that the city's fire marshal has provided updated maximum occupancy limits, and new signs are being held are posted at the doors related to this COVID response. Food and drink, you'll see further down, is also 25% occupancy in the enclosed space. Thank you, Mayor.
Thanks so much.
Thanks, David. Let me clarify something, David. So you're telling me, in fact, you answered one of my thoughts or questions. So you're telling me, like, let's just use a hypothetical. Acme store has, they have 100% occupancy, and you're saying that we already know that it's 100, and we already put 25. Only 25 people can be here, and it's posted at the front door.
Yes, sir, Mayor. I'm aware of several businesses, and I believe the fire department has gone through and provided those occupancy limits. Those occupancy limits are established by the building and fire code. That's why it's issued by the fire department, right. Prevention services, and then they take 25% of that occupancy.
That's excellent. That gives us a big step up on and getting back to EFO. EFO, there you go. I don't need a proclamation. If you direct your team to make sure that's at 25%, that'll be a huge help, because I know I've passed by some bigger box stores, and I'm just counting the cars, and it's more than 25% of their spaces are occupied. I mean, I don't know. There could be 25 people in there, but there's a lot of cars out there. So if we can work on that as well as what else we've done, I think that's a huge start. Okay, so get back to
David. Yeah, thanks so much, David. I that's exactly right, Mayor. I mean, I feel like this tells us sort of everything and the way that we should move forward enforcing some of these things. I absolutely get that we don't want to. I want to make sure that does LCPD and the fire department, do they have the right equipment? Do they have the right PPE in order to start doubling down on enforcement? And then that's my last question. I just feel like we have to absolutely start taking this with considerably more urgency if we want to get off this list, if we want to get off this pretty terrible list. Thanks, Mayor.
Mm-hmm. Okay. Councillor Beda-Stuvey.
Thank you, Mayor, and thank you to my colleagues for their questions and comments. During this time, we've seen a lot of fluctuations, and we've had to act. And I think this is another time that we are going to have to make those adaptations to strike that balance between healthcare, that mental, physical health, economic health, and they all tie in together. I'm very concerned with enforcement. A lot of my questions were answered. However, I did get a call from a local business in my district that has had some issues with gatherings near their area on its private property. The owners of the property have called, said that there was gatherings happening on that property. And when they did call our local enforcement, they did not have anybody show up to get these people off of the property and to stop that gathering. And it was well more than 5. I mean, it was huge. And so, and the same group is intending to gather again on the same private property where the property owners that hold it don't want them on. And so I think that's also something that we have to look at, is just making sure that we're looking out for those large gatherings as well, because in these groups, they're not masking while they're in these groups as well. It's very large gatherings. And then I have a local business that is doing everything that they can to protect themselves, their staff, and their customers. And then they're even being harassed by these people that are doing that. And it's very, very troublesome and very worrisome. And I want to make sure that we are staying consistent with that enforcement as well. We're asking a lot from these businesses as well. We want to make sure that they stay open and they're doing the right thing for themselves, their customers, and for the community. And so I hope that, if others don't intend on doing that, that we can work on those enforcement directives and to look at gatherings. I think clarification might be needed for myself from either Jennifer with the emergency proclamation that you have. It talks a little bit about enforcement, but given that we have the state directives, we can still work off that for our enforcement, correct?
I think so, Councilor Beta-Stuvey, but I think you just gave me some food for thought. So let's just say there's a business that has told a customer, hey, I need you to wear your mask, and they say, no, I'm not going to. Well, then I need you to leave with them. No, I'm not going to. If I think then what I may have to do is issue another proclamation, and now we find individuals. Before we didn't. We left that off to the state. Right now, that's the state's rule that you have to wear a mask anywhere you go, and only the state is usually the one who does that. But if we go and pass something like that, or if I go and do that, now it can be both business and individual for the ones who don't want to conform. Because I know that I've heard, I don't know, but I've been told that some individuals that go into stores, they just say, well, I'm not going to wear a mask. And so, okay, well, then, we don't want to have to deal with something. I mean, we don't want them to we don't want to have to fine them. But I mean, again, I'm doing everything I can to so that we don't unfairly hurt those that are conforming, that are doing their best, that are doing what they need to be doing, that are being responsible. Okay, and you've got these others that are being irresponsible, and just just like anything else, we don't want to do something that's over reaching for a few bad actors, or some bad actors who aren't taking care of business, who aren't doing what they're supposed to be doing. So I think that's the case. So to rephrase that, Jennifer, if we wanted the city codes, police, whomever, to find someone individually for not wearing a mask in a store, probably best would be for me to put a proclamation through. Is that your understanding or not?
Mayor and council, I'm sorry, I'm having network problems, so I can't look things up on my computer right now. But the way that this proclamation is drafted, we can enforce now.
We can enforce the governor's rule?
We can enforce the governor's rule, and we also incorporated the mandate of the original proclamation that is still in effect. So a violation of an emergency proclamation is an ordinance violation.
Okay, so what would be the fine for the individual? Still the 50 or so? Correct.
Because it would normally be what a petty misdemeanor would be, but in your original proclamation, you did, you put a limit on that. So it would be $50 unless we change that.
Unless I change it. Okay, thank you for that clarification. Councilor Beta-Stuvey, was there anything else?
Yes, just one more. And it's just the thought that when we do have these actors, it's not just one person that they affect. It's not just themselves. And I think that is a message that perhaps, unfortunately, needs to be said at this point, that when you can be potentially an asymptomatic carrier, when you can be sick at some point, and when you go out into these spaces to others, you're possibly violating the health and safety of others. And that is something that I guess I just don't understand why people are not taking that as seriously as they can, because it's not just themselves that they are affecting. And at this point, we're getting very close to tipping the scales past the point of no return, past the point of dire emergency. And we have to start taking that responsibility on ourselves, that we could possibly be asymptomatic carriers. We have so much community spread now that it's very hard I think to really truly tell where you're going to get it, you could get it at a store, from coworkers. There's lots of different places that you could become infected. And so at this point, we all have to take this very, very seriously and very responsibly if we're going to try to keep our systems moving. And that's economic. That is with our physical, mental health. You know, it all works together. And so we have to look at each of these pieces. And I do fully support your proclamation. I think we're at the point that we have to really, as Councillor Bencomo said, put some teeth behind this enforcement, because we need to try to prevent from having these decisions and possibly affecting others. Thank you.
Thank you. Mayor Pro Tem?
Thanks, Mayor. Thank you to my colleagues. I really appreciate, Mayor, you putting forth the emergency proclamation. I think that's really important, and I feel like we need to strongly step up enforcement. I am in favor of providing the funding necessary, not only to our law enforcement, but to security guards to assist. I'm appreciative of the proactive approach that law enforcement and fire have taken, to figure out the 25%, and give the capacity from there. I continue to be concerned about community spread. When you think about places like the Animal Services Center and those essential programs that the city runs, I think we need to have some stronger provisions in place to include temperature checks and rapid testing, to these entities that the city is responsible for, because those are folks that have to be essential. They're essential to making our city continue, the infrastructure and whatnot to run. And so I want to be able to give the tools and the supplies necessary to ensure that is taking place. I'm really concerned. I don't think a lockdown is of concern for all of us, but I agree that we need to take personal responsibility. And I'm not sure that, I think as Councillor Abeyta-Stuvey has indicated, there is community spread. So you think of 1 in 6 people are affecting 6 people. So what do we do? I know, Mary, you want the curfew to be, the last possible option, but I'm really concerned. I'm seeing a lot of things on social media about Halloween and people coming together and having kid parties and those things because, of maybe Halloween being canceled. I just don't think that's the thing to do. I'm also hearing as entities or agencies that are having positive tests and whatnot, it's because people are social gathering, right? They're gathering in their homes, families not wearing masks. And I think that a curfew is probably in order. I don't believe that just with your emergency proclamation, increased enforcement is going to do it. We just don't have enough people. It's clear to me when you talk to people. So is it within, I asked David Dullahan because we're on this list, right? And I'm asking what happened. I don't want to know the details, who the person is, the employee, but they're gathering in homes or outside having parties, more than 10 people, sometimes more than 5 people now. And so I just think we need to have some stronger provision strategies moving forward. I'm particularly concerned with the holidays coming, Mayor. So I appreciate it. I just wanted to weigh in on that and to start from the city's functions, temperature checking. I think that's an important thing, because what you're hearing is people are coming, kind of allergy symptoms, and I maybe more education needs to occur as well in terms of what to look for, and that you shouldn't come to work sick. But at the same token, we need to have more testing, because so many folks are asymptomatic and not. And I guess, Mayor, I need to have those numbers to be able to make an educated decision about how to move forward. And so I know that we're going to talk about that later. Right. I don't know if it's, I know you're incorporating everything that we're saying, really taking to heart what we're saying. And again, I'd like to know what the Department of Health is doing, how many tests we're giving out daily. What's difficult is when people feel sick, they want to get tested immediately, and that's not happening as quickly as we want it, and the results aren't coming back as quickly as we want it as well, so we could get people back into the workforce. And so I think all those things, if we're going to make these sort of provisions, that we need to have all the tools in place to make sure that we're helping as many people as we can quickly and efficiently. So thank you, Mayor.
Yeah, EFO has something, and then I know Councilor Flores, and then we probably need to do a vote, and then we'll go back and discuss the COVID stuff. And I'll still be taking notes. EFO, you had something?
Yeah, thank you, Mayor and Council. And I know we're going to discuss, some of the issues that were brought up here in the meeting. My comment has to do back with law enforcement. Like I mentioned, I'm going to give direction to our police to turn up the heat there. I know they've been taking it seriously, but as far as citing, if that's what we want to do, that's the direction we're going to move in. But I do want to state publicly, and maybe we should all recognize when we all start getting the calls. We are going to be putting our police force in a precarious situation, right? I mean, in order for people to, when we cite them, they have to sign the citation. And if they refuse to sign the citation, typically you get arrested. And so, right. And then there's also the possibility of use of force. I mean, there's all kinds of things that can occur that are going to come from citing people. But I mean, we're at a point now, and I'm hearing the council loud and clear about wanting to enforce. And I'll pull in my Interim Chief Dominguez, and we can talk about it. And I mean, okay. It's there's no discussion to be had from what I'm understanding. But as far as what's going to come, just be prepared. I just want everybody to be prepared for that, because I think that's going to be inevitable. You're going to have people that are going to refuse to sign. We could talk about how we diffuse some of that, but that's the teeth. That's the process. Is you give them the citation. If they refuse to sign the citation, you arrest them, and so you're going to get backlash for arresting somebody for not wearing a mask. And so we just need to be prepared for all that, everything else that comes with that, and recognize that we are going to be putting our police force in a precarious situation. But again, that's the direction we're going to go.
All right, Ifo, thank you. Councilor Flores?
Yes, Mr. Mayor, thank you so much for your emergency proclamation, and I'll reserve further comments on COVID after we vote on it.
Okay, I appreciate it. Okay, with that, Christine?
This is on the motion to approve resolution 21-067. Councilor Beta Stevie?
Yes.
Councilor Vasquez?
Yes.
Councilor Bencomo?
Yes.
Councilor Sorg?
Yes.
Councilor Flores?
Yes.
Councilor Gondeta?
Yes.
Mayor?
Yes. Okay, so thank you for that. And so next we're going to go to COVID update, and I'm going to see who's going to kick that one off. I know Ifo has his hand up, but I think he maybe forgot to put that down, or are you going to kick this one off?
Yeah, sorry, Mayor, I forgot to put it down.
That's okay. Either David Dalahan or,
Mr. Mayor?
yes, Councilor Flores?
Yes, so I reserve my comments.
Oh, okay.
Yeah, thank you. So I'm happy to, very happy to hear that Mayor Pro Tem believes we should have some sort of a curfew or a lockdown. I think that's what I understood. I felt strongly before that, before this horrible, and I think I personally believe we should have a curfew, and the curfew wouldn't be the lockdown. I mean, the mayor has already said stay at home as much as you possibly can. The curfew would be something, like from a certain hour in the evening till, a certain hour in early morning. So that's what I propose insofar as taking steps and measures that keep people, make people aware of the fact that you just can't be out, whatever. It'll be a check on behavior. As far as the mask wearing goes, I know that when I put on a mask as I leave my car to go into a store, all of a sudden I'm more conscientious about keeping my hands clean, keeping my distance from other customers in the store. So I think that that's very important. I had another comment and I didn't write it down, so I'll reserve that for later. Thank you, Mr. Mayor.
Mm-hmm. Okay, anyone else?
Mr. Mayor.
Yes, David.
David Dahlon for the record. Members, City Council, the city staff does not have a formal presentation today. However, there are several people that have joined us on the line for the conversation, and I would encourage us to start the discussion. We have representatives from New Mexico Department of Health, including Don Sanchez, the Southwest Regional Director, Dr. Marciniak, who is the Regional Medical Director for New Mexico Department of Health, and Dr. Salina Torres, who is the State Acting Epidemiologist from Department of Health. We have Amanda Bowen from the Office of Emergency Management. And then we have Fire Chief Eric Enriquez, Police Chief Miguel Dominguez, and most of the department directors are online or available for questions and discussion. But I would start with your questions that are directed toward Department of Health. And maybe Don Sanchez may have some opening comments to questions that we had shared with him earlier in the week when this meeting was called.
Yeah, I think that's a great idea. I know Councilor Betastubi has a question real quick.
Thank you, Mayor. I put my hand up. I was going to say, I think it'd be great to get kind of an update from each department first to kind of see where everybody is standing at the moment, and to hear what they have to say. And then we can proceed with some further questions. And I know, like I said, I know that I had quite a few questions that I've sent to you beforehand. And so I'd love to hear from each department first, and then work towards questions.
Okay, I think that's a good idea.
Good morning, everyone. This is Salina Torres, infectious disease epidemiologist from the Department of Health. I think Don and I can give a good update for the Department of Health. It's no surprise to everyone that our numbers continue to rise. Our effective, which is, the number of people that one person can spread the infection to, also continues to go up in all regions of the state. Let's see, what else can I tell you? We are just very busy, with all of our cases, and unfortunately, because of the surge in the case counts, that just extends the time that we are able to reach an individual to inform them of their results, give them isolation instructions, and collect their exposed contacts. And then also extends the time that we reach out to the exposed contacts and give them instructions to quarantine. So As you can imagine, we are busy, and just trying to stay on top of as much as possible as we can. Dawn, do you want to give some regional updates?
Yes, good morning, Mayor, City Council. Sure, Dr. Torres, I can give some regional updates and I think a few answers to Councilor Stuve's questions, also one that Councilor Gondar just mentioned. I just wanted to say too, so as far as testing in the county and for the county in Las Cruces too, for the county, we're averaging about 475 tests a day, and that's between Department of Health and some other entities or FQHCs. I will also say that Pathology Consultants is hitting about 300 a day. They've done up to 550. So we're testing Monday through Saturday here in Las Cruces at our office, and Pathology Consultants is Monday through Friday. So we've had definitely increases in testing since the beginning of October. In all honesty, it was pretty quiet a little ways back before Labor Day, and then it's just increased. So we are definitely testing quite a bit. We are also looking at the surge capacity. A couple things coming up is the Federal Health and Human Services Department is going to be sending some contract medical staff into the state of New Mexico with 10,000 test kits. For Doña County, we're going to get 2,000 of those. So over a 2-week period of time, I'm not sure the timeline might be actually starting next week. I think they're getting the supplies ready to go, but there's going to be a surge for just increasing the testing. So that will happen throughout the county, probably a lot of big events here scheduled for Las Cruces. There will be, there's an online registration. The piece about that too is the samples are going to be sent to a lab outside the state for a quick response too. The other thing is the state is definitely looking to outside labs to increase our lab capacity. As Dr. Torres said, our lab is overwhelmed pretty much right now, working with SLD and Tricor, and the state is looking for other avenues to be able to have lab capacity to increase the number of to turn around, have the results turnaround time a lot shorter. A quick update too, we do have the NMSU lab. So the NMSU lab is run by Tricor, and they do have the Panther, the rapid response machine there. Their capacity is about 500 tests a day. They're just kind of streamlining their process. We're working with them on that. They are also taking the labs from the Aggie Health Center. So they're working with the NMSU population plus others within the Tricor family, so to speak. We're working with them to be able to also access our SLD requisition, our application online, so that we can really utilize that lab here locally for a quicker turnaround time. So there's some bugs just to work out as they get up and running, but they've been up and running probably early October is when they started taking samples and releasing those samples. So we're definitely aware of the need to increase testing. We're also aware of the need to hopefully get those results back. I think we do want to encourage anyone who is symptomatic that goes for a test while you're waiting your results to be able to isolate, to find ways, if you can telework or what have you, that you're able to isolate that way. There are also going to be additional National Guard members coming into the state, and we've requested some additional teams for our region. We would, requested one for basically out of Las Cruces. So we're hopeful that will happen, and they've been extended, I'm pretty sure, through the end of the year. So we continue to have that support, and I'm sure into next year as well. We as well are working with the BCom medical students, and even some of the NMSU nursing students have come through our COVID testing line to learn the process. So we're as well trying to just expand the knowledge and access for folks to be able to provide the test. All, again, in partnership with trying to not overwhelm the lab, find ways, though, to get the results back quicker. So those are some things that we're focusing on here, not only in Las Cruces, but also, throughout the county.
Nope. Okay.
Mr. Mayor?
Yes, Councilor Flores. Well, I have Councilor Beta-Stuvey and then Mayor Pro Tem, but yes, Councilor Flores.
Well, I'll wait my turn.
Yeah, I just text me like you're doing, and I'll put you in the queue because
Okay.
I can't see. Yeah, so we have Councilor.
There it is.
Okay.
Thank you.
And then Mayor Pro Tem Gondara. So Councilor Beta-Stubbe.
Thank you, Mayor. Thank you, Dr. Torres, and thank you, Don, as well for that update. I know last time we chatted over the summer, we had talked about how that test processing was going to be so important down here. And at the time, council was told that by, I think it was in July 1st, that NMSU could possibly be ready to do kind of community testing. And so now we are in our October now, and I know that your department is feeling that strain and stress as well. What other state resources can be brought to Doña Ana to help with that? And are there other avenues for test processing that the state can bring down here fairly quickly to help accommodate this surge, especially since we know that El Paso is just increasing and we are now a hotspot, just like, and that quadrant was when this first happened.
So Don, I can answer a little bit of that and then maybe you can supplement. So one of the things that some sites have done is stand up rapid testing so that it doesn't need to go out to reference laboratories. And there's, pros and cons to that. The pro obviously is that, it doesn't need to be sent out. You can do it quickly and have a result. But unfortunately, we're seeing more and more data and studies come out. And even in cases that we see at the Department of Health, there's a, false positivity that happens. And then we have to, supplement or confirm with a PCR, which is the send out test as well. So, so as we continue to get more data on those rapid tests, we can, stand them up more appropriately. They really are to be used for individuals that are symptomatic. So I know the concern in your community is to get, a good handle on these asymptomatic individuals that are, walking around in the community and potentially exposing others. So PCR is still the gold standard for that group, section of the population. I'm not aware of whether NMSU is, working towards expanding their capacity. That's one option. And then I think, partnering with outside entities outside of the state. However, that does create a lag, right? Because the specimens need to be shipped and then we need to get the results back. So there are complexities, but, we still continue across the state to test, 10 to almost 10,000 a day, which, if you look at New Mexico and how it ranks with the United States, we're like 5th in the country in the amount of testing that we do, which is really just remarkable considering, our little state and how we stood things up pretty quickly. But Don, did you want to add anything to that?
Mr. Mayor, councilors, Dr. Torres, no, I think you're right. The state is absolutely looking at options for rapid testing, but like Dr. Torres said, there's been some questionable the validity with them in the fact that they have, as we've done some tests on them, they're rapid tests, but they've also provided some false negatives. And so that requires a PCR test, the lab test on top of that. So we definitely are looking at ways to increase, have that rapid test available. But the ones that I guess we've been looking at right now, there's still some questionable validity around that. So I think the state continues to look for what would be a viable option to turn that time around quicker.
Thank you, Dr. Torres, and thank you, Don. I'm glad you brought that up about the rapid testing. We heard in a subcommittee the other day a statement that about 42% of those rapid tests were the false negatives, and that I know for the schools, and Don, you can correct me if I misheard, but they required a different type of test to be allowed to be seen as a true negative. Is that correct?
Councilor Stuve, I understand, and Dr. Torres can fill in, but you would need to do a PCR test to be a confirmatory for the rapid test if it comes back as a false negative. Yeah.
Okay.
For all
Thank
negative.
you. Yeah. And with that in mind, as far as I think it's wonderful that we're seeing it's 10,000 tests in New Mexico per day. With that, having only 475 for kind of public usage for Doña Ana County. If Pathology Consultants does 300 to 500 a day, yes, we do have other private entities that can do the rapid responses, but those usually have costs associated with it. And so a person that is feeling sick and doesn't have those types of resources, I know often it's around $100 I've been hearing to have these private places test. That's not going to be very accessible for the public. And those types of numbers for our community size really, really need to increase. And I think we've said that before. And so I'm glad to hear that we're getting extra tests down here. But if we are a hotspot, and if we are seeing this type of things, I would even suggest that perhaps resources are allocated appropriately to accommodate those types of surges from the state level down here to make sure that we are able to help test and trace and take a hold and control of this community spread. I'm just very concerned about that right now. I think we're seeing in El Paso, it looks to be the trend that their percentage of asymptomatic population is going down, so that we're seeing more people that are sick. I don't know, is that a trend that we're also seeing here in New Mexico in Doña Ana County?
Yeah, so I agree with you about the concern on the testing. And, one thing that we do, we look at the data. And
Dr. Torres, I'm sorry for interrupting, but do you mind stating your name when you?
Oh, yes, I'm sorry.
It's just the person taking the notes, they don't watch the video.
Yes, sorry. Salina Torres, Department of Health. Thank you, Councilor Stuve, for that comment. You're absolutely right. It's concerning when areas are hotspots, to get the resources there as quickly as possible. And we do, at the Department of Health, look at the data and try to identify, sort of what we term hotspots to see if we can direct more testing or resources in that area. It's not a perfect science, but we do keep an eye on that as much as we can. And I stand corrected. We're actually 7th in the nation for testing, but still pretty good. And then your comment about symptomatic individuals. So, the data currently looks the same. I don't have it at a county level. Maybe as we're talking, I can dig a little deeper. But it still seems like what we see, what we've been seeing throughout the pandemic. I believe it's about 40 to 50% of the cases are symptomatic. But let me dig in the background while we're talking and see if I can get a better estimate of that for you. And I would anticipate that as we begin with, into the flu season, that we're going to see more symptomatic individuals that may not have gone out and been tested, and now are going out and being tested and then presenting with symptoms that may or may not be COVID related.
Thank you. I appreciate that.
Thank you.
I have more questions, but I think they're each for different departments. So I'm going to stop right here. Thank you, Mayor.
Okay, thank you. We have Mayor Pro Tem and then Councilor Flores.
Thank you, Mayor. Thank you, Dr. Torres and Don, for being here with us today and for the information thus far, and for Councilor Abeyta-Stuvi's questions. She's asked a lot of the questions that I wanted to ask. But just for the public's sake, could you tell us what the spread rate is, what our case counts are, what hotspots or particular zip codes that you're concerned about in Doña Ana County?
Absolutely. This is Salina Torres, Department of Health. Let me go ahead and pull up my file here. So, in the last week, Doña Ana County had 798 new cases. And when we look at what we call the our effective or infection rate, for this week, it is 1.19. As I mentioned, it has gone up for most regions in the state, unfortunately. And And then what was the other data point you wanted to know?
Zip codes that you might be concerned about in the county that we need to be aware of, or specific to Las Cruces. I guess to me, this is really important for the public to know. And I know there's a dashboard and we refer people over to it all the time, but for the public to know what zip codes are most concerned. Dr. Torres, I know you're keeping an eye on that, as most public health people are. And I also want to know about, for every one person, how many people are they affecting?
Right. Okay. Salina, this is Salina Torres. So for every one person, we have 1.19 persons being infected. So it's still hovering around 1, which is higher than we would want. I believe in August we dipped pretty low down, especially for the Southwest region. Right. And let's see. And then I also wanted to, another figure that's pretty important is percent positivity. So, this allows us to estimate the percentage of people that are being tested, how many are testing positive. And for the Southwest region, this has continued to rise since the middle of September. And so it's now at 10.8% positivity. And the state is around 10% as well. So, so that's pretty high, and reaching, over 10%. I think our goal is less than 5% is what we had hoped, and we're at, sort of in August. As far as zip codes go, it's a little tricky. I really appreciate people keeping an eye on their zip codes and seeing what's going on. But as we all know, especially in your community, people, there's a lot of movement, even into El Paso, back from El Paso. Right. So, and the zip codes that we report on is the residence that's reported to us with the laboratory result and what the person identifies as their place of residence. I don't have an exact handle on which zip code is the hotspot currently in Las Cruces. But I will say that it should be taken with a grain of salt, because there's a lot of movement and people move around, and potentially, they could live in Las Cruces, but then work in El Paso, then come back. So I think the message is that, I think Councilor Estuve said this, which is it's community wide at this point. Yeah. It's all over the place, unfortunately.
Right.
Mayor Pro Tem and Dr. Torres, I thanks to Commissioner Reynolds, I actually have these zip codes here. I don't know where he got them from, but he has it broken down. Let's see, Garfield, Hatch, Rincon, and Salem, 15. Las Cruces, 88001, 37. White Sands, I presume White Sands Missile Range, 1. Las Cruces, 88005, 23. Las Cruces, 88007, 18. Santa Teresa, Sunland Park, 9. Las Cruces, 88011, 23. Las Cruces, 88012, which is the East Mesa, 32. Anthony Berino, 24. La Mesa, 4. Sunland Park, 22. And Chaparral, 27. So I think this was maybe a couple days ago.
Yeah, thank you, Mayor.
It looks like it's kind of spread out.
Yeah, it's pretty
Before
spread
it was, remember how it was a lot of concentration in the South Valley, and now it's
everywhere, for sure. Thank you for that, Mayor. I appreciate it. I think it would be helpful if someone at the city would be tracking these and giving us weekly updates moving forward. Also, my next question is about, what are you hearing when the contact tracers are out and, with folks? Where is most of the where are they saying they've been? And is it typically, indoor restaurants, large gatherings? Are they giving you any indication of where that's coming from?
Yes, this is Salina Torres again, and they are. So that's part of our case investigation process that we ask where individuals have been in the 14 days before they got sick, and then from the time they got sick until we reached them. And gatherings continue to be the biggest thing that people are reporting. I'm just looking at the comparison in gatherings of the different regions of the state, and similar to case counts, the Southwest region kind of tracks second place from Metro. So Metro tends to be the highest because there's higher population density, and then the Southwest region cases are the ones that report more often that they were involved in gatherings, in the time before they were sick, or while they were sick, unfortunately. And I just found the data related to symptomatic cases, and it actually has gone up significantly since the summer. And so we're looking now at about over 80% of our cases reporting symptoms when we reach them and conduct the investigation. So, as we would expect, we're sort of a large community with our sister city and state, and so you would expect that it looks similar.
Thank you, Dr. Torres. I think that is so helpful and will help guide me as I continue probably to advocate for a curfew. I just don't see it. If you're saying that we're like, that's where most people are admitting or just saying, right, this is where what I'm doing and where I'm at, and they're not wearing their masks. I mean, I think when you go to family members' house, you gotta wear your mask, and be cognizant of the fact that, when you go out to stores and whatever, and you bring whatever it is that you're doing with your family members, visiting, giving, providing groceries, whatever the situation, it doesn't give you the pass to not wear your mask. You should wear your mask and wash your hands and not social gather. Can you, I understand that, Dawn, you're changing your times and testing, you're changing a little bit. Can you repeat who is actually providing tests? Do we have an idea? And I'm thinking there has to be someone here from emergency management. Like, who are they? How many tests do they get? How many tests are they providing on a daily basis? I think would be important. I heard on Monday an individual, I received several calls and texts and from Facebook, an individual trying to get tested. And meanwhile, this individual, 20-something-year-old, working, can't go back to work until they get tested, went to several places, and the places that I had referred to, like Amador and others, didn't have testing or supplies, right? So I just want to make sure that as a city mayor, that we're offering as many the resources to ensure that folks can get the testing and get it rapidly back. And I don't mean by using a rapid test, but getting it quickly back so that they can go back to work. I think our businesses are trying to be responsible, but there's some gaps and barriers.
Not working.
So sorry, I went off there, but I'm looking for a list publicly that you could say that are providing testing, Dawn, and specifically to Department of Health. What are your hours?
Sure. This is Dawn Sanchez. Thank you, Councilor Gondra. Mayor, for the Las Cruces Public Health Office, so we test Monday through Friday in the morning it's going to be starting on Monday with the time change 7:30 to 10. And then on Tuesdays and Thursdays from 3 to 5. And then on Saturdays from 8 to 10. I will tell you, pathology consultants as well tests Monday through Friday from about 9 to 12. Depending on their supplies, it might get limited. Again, they're trying to cap it at about 300 just with supplies. They did over 550 on one day though too. So they're available. We're also working with La Clinica de Familia. They are doing testing in the southern part of the county, and then also on Mondays they're here in at their Central Medical on Alameda. So they provide testing there too. You know, those are, and then as far as I'm not, you know, I can get more information to you, Councilor Gondar, about other private entities. I think these are the ones that are doing just anyone, the asymptomatic or symptomatic, coming to these specific entities. But I can definitely get you more information if there's, you know, I don't know if our CVS is doing it here or other places are doing those here in this community. I'm not quite sure.
Yeah, I understand that CVS is doing them here, Dawn. I guess what I'm saying is that the powers that be that should be responsible, knowing who the entities are that are testing, if they need if it's private, if they need insurance, how much. I mean, I really believe there needs to be a list that is updated, keep current, and that is being asked of some entity to compile and keep updated, and it be placed on our COVID website. To me, that's really important because we have folks that are running around town trying to find testing, and I just think it's not the best system that folks are running around. It's already stressful enough, and running around trying to get a test is I don't think what we subscribe to here. You know, because that means that they're I don't know how, if they're going into a facility, if it's on a drive, you know, through type of situation, but we have to think if they're, you know, one person is affecting 6 or so folks, that's problematic. So I just want to make sure that we have information so that we can refer to, and that it's current and constantly, if it's changing, that it's kept up to date. Someone mentioned that the Aggie, the lab at NMSU is up and running, and Dawn or Salina, are the numbers that you gave to us, are they included in that, or is that separate? Does that make sense?
Yes, Councilor Gondar, this is Dawn. Some of the numbers that I gave you are included in that from the Aggie Health Center. We've been working really closely with the Aggie Health and Wellness Center and just the sports medicine at NMSU to help them assisting with testing. So their numbers are included with us. I think the Tricor Lab at NMSU does an additional, I don't know, maybe about 100 or so, not I think where we thought it would be from some of their other assisted living facilities or what have you that are part of the Tricor entity or subscribe to the Tricor Lab. So their capacity, I think, is greater than it is. I'm sorry. Is greater than it is. I think that's why we're trying to work with them to work out some streamlining of their system and their way you register for them. It's a little bit cumbersome, just to make it easier to access that. So
Gotcha.
Yeah, so we're definitely working with them. I did want to mention too, and I appreciate your comments about having just a list. And in all honesty, a lot of this is just based on the available resources we have, you know, especially with our staff at the Department of Health. We are also charged with doing flu shots, and then the COVID vaccine is a whole nother thing that's going to be on our shoulders come probably end of November, early December. You know, we're going to continue to try and maintain the COVID testing to the best of our ability.
Sure.
We do also, you know, we're focusing too on the southern part of the county. I just want to mention this real quickly because there have been, outside of Las Cruces, you know, the higher numbers are going to be in Sunland, Chaparral, Anthony. So today we're actually in Sunland Park doing a big testing with Lieutenant Governor Howie Morales, scheduled some testing for Sunland Park and Anthony. So that's also going on, but we're very conscious of wanting to do more testing in the South. La Clinica does great testing in the South, and they've been at capacity, over capacity every day that they do testing down there for the past couple of weeks. So we're really working with our partners to get as much testing out there as we can, but it's so dependent on the capacity resources that we have, along with the test kits. But we haven't had an issue with our test kits coming in. We're pretty stable with those numbers there. as far as any insurance issues with folks being charged for testing, that, you know, that should not be happening. The Office of Insurance Superintendent for the state, there's a number for people to call. If they do get a bill for testing, they can call that number and that should get rectified, rescinded, what have you. So I can provide that number too. So there shouldn't be issues with that. I mean, you know, entities are, unfortunately, I think that there's some charging that it does happen, but there is a way to get those costs removed as far as I understand. I just wanted to mention that. But we can definitely keep you up to date on what the schedule is. We are also trying to find an indoor testing location because as the weather gets bad, I mean, we had snow here in Las Cruces this past week. We couldn't test outside that day, so we are looking at utilizing some pod sites, possibly to do some indoor testing as the weather gets cooler. So any assistance in that area would be helpful. We're working with OEM, with Amanda Bone and Cullen, with the pod sites that we have to potentially have other avenues for testing, which could be larger groups as well.
Sure. Thank you, Don, for that. I appreciate it. I'm wondering with that if our convention center could be that site. Mayor, I don't know what kind of discussions have been had, but I think that's, I appreciate hearing that. And you know, Don, we're here, whatever you need. I've often have felt like as we're seeing these high numbers of diagnosed tests, diagnoses, which means that we need more contract, tracers, and it also means that, we won't get the results as rapidly, right? And I love what you said. If people are feeling sick, they've been tested, they have to quarantine, isolate themselves until they hear that. So if the city can help in any way, IFO with staff that gets trained on that to be able to help moving forward, I think that's something we really need to do. So those are all the questions at this point, Mayor, for me. Thank you.
Okay, we have Councilor Flores and then Councilor Bencomo. Councilor Flores? Councilor Flores, okay, well, I'll go to Councilor Bencomo and I'll come back to Councilor Flores. Councilor Bencomo?
Thanks, Mayor. Thanks so much, Don and Dr. Torres, for your presentation. I really appreciate you being with us today. Mayor, the more I listen to what Don and Dr. Torres are saying, the more it's clear to me that the system is feeling a significant amount of pressure already in terms of testing, in terms of capacity, in terms of who can do it. I mean, I think it's incredible that La Clínica is stepping up and they're at a max capacity as well. I don't think, I think it's really incumbent upon us as leaders of the city to really take leadership in this moment and not wait till the state, says we should do something else. I really think, the more and more I am wanting to side with Mayor Pro Tem about the necessity for curfew earlier than later. I would love to hear though from Don and Dr. Torres about how they're feeling in terms of what are your thoughts around curfews and those kinds of added measures from your point of view?
Talking about me or are you talking to Don?
I'm talking to Don or Dr. Torres.
Oh, okay.
Councilor Bencomo, this is Salina Torres. Yeah, I can comment. I was just, as you guys were talking about masks, as the council was talking about masks, and I know I'm preaching to the choir here on this, but, evidence is starting to come out that yes, in fact, masks do work. And it's interesting, we just were informed of a study where within a household, you can reduce transmission by almost 80% if everyone is wearing a mask. And then there's no documented transmission on airplanes if everyone wears a mask. Wow. So I think that I really applaud your efforts in trying to push the mask usage and proper mask usage,
Yes.
I think is extremely important. I was also trying to look for some evidence for curfews. I didn't quite, I think that's still coming out. But what I will say is that, the more we can reduce the strain on our resources, the better it is. So, having a curfew allows, let's say, law enforcement to be able to just do the things they need to do with regular law enforcement versus having to still go out and monitor for mask usage and those types of things. And the recommendations for curfews are based on evidence, suggesting that limiting people's interactions in the late night hours could potentially stop the spread. So I definitely think it's a good idea. I understand that there's lots of consequences surrounding it, right? I mean, how do you figure out if somebody's going home from work or versus coming home from a restaurant or a family gathering, or there's a lot of infrastructural things that need to be taken into account. But I think, reducing the strain on the already strained systems is should be sort of the goal here, and kind of putting the responsibility on the community to help out as much as they can.
Absolutely. Thanks so much for that, Dr. Torres. I really appreciate it. For me, since the beginning of this, I've said that I wanted to make decisions based on evidence and on recommendations from the medical experts. At the end of the day, you're the front line on this, and I think it's important that we listen to what you're saying, particularly because you're the ones that are feeling that strain. And so, Mayor, again, I whatever we do, I think we have to do it with some of these things in mind that Dr. Torres and Don are saying in terms of the pressure on the system. I'm curious, Don or Dr. Torres, I don't necessarily think we're anywhere close to having to open up a separate location as a makeshift hospital like El Paso did. Councilor Flores, your mic is on. I don't think we're anywhere near, right, having to do a makeshift hospital like El Paso just did with their convention center. What are your thoughts on that in terms of where Doña Ana County is in relations to hospital capacity?
This is Salina Torres. I would defer. I think we have some OEM folks on the line, if I'm not mistaken, that can speak better to hospital capacity.
Hello, this is Amanda Bowen with the Office of Emergency Management. We have an entire structure that tracks multiple points of the COVID response. One of those is our Healthcare Coalition and Community Tracking. Her name is Jackie Saldana, and she does a regional track of hospital data to look at hospital capacities for ICUs, ventilations, the ER, med surge, all of those types of things. I can't speak specifically to her data because I'm not responsible for that area. I can definitely get that information to you so you can look at what our capacities look like. But there is some growing concern. We've had recent phone calls with the hospitals in our area to discuss. So the Las Cruces hospitals are really the hub for many of the surrounding county hospitals. So looking at as each of the hospitals has started to increase in their usage and decrease in their available resources, we've looked at what some available options are. It looks like some of the lower level medical cases are being stacked up within the hospitals right now. So we're looking at relieving that by expanding some of our isolation locations. Those are very people who maybe just need a little bit of oxygen, but they need a little bit of oversight from nursing staff. So our Medical Reserve Corps and our isolation locations are expanding with the state's assistance to be able to provide that extra care outside of the hospital setting to then open up some more availability for the hospitals. So it wouldn't be to the level of what El Paso is doing. We don't feel like we're there yet, but there are constant communications back and forth with all of the area hospitals and back with the state so that we can get the support that's needed because we know that our resources here are limited to be able to provide that kind of medical support. So
thanks, Amanda. Amanda, I thought I saw recently an article about a nursing staff shortage. Can you speak about that?
Yes, ma'am. I think this is my things that I've heard, not necessarily factual based, but it seems like just across the country there's a shortage to nursing staff and medical staff. I know in our area, if you talk with our Department of Health personnel who's conducting the testing, they're going to tell you that they're reaching to every corner to try to find people to help them augment their testing. I believe the same is true with the hospital staff. Any of the medical entities are feeling the pressure, both as they're experiencing COVID outbreaks in their staff or they're needing to test their personnel. As they're, many of the people who work in the medical field have multiple positions in different facilities. And so some of them are having to narrow that in as facility rules are changing. So there is a concern that we don't necessarily have as many medical personnel as we need. But again, that's another reach back to the state. And we're getting some support through National Guard and other resources to help us in that manner. Right now we're doing okay, but it's always something we're keeping an eye on.
I mean, hearing it from, folks at hospitals and staff sounds pretty factual to me.
Yes, ma'am. I feel like I can't give you, a percentage of deficit that we're at. I can just tell you that in those conversations, it's very much a conversation that's happening.
And what will be the role of the National Guard? Do we have National Guard in Las Cruces, Doña County already?
Dawn, you want to take that one?
Sure, Councilor Bencomo. This is Dawn Sanchez, Department of Health. Yes, we've had National Guard in Doña Ana County for, probably since April. We've had National Guard, and they have been helping with, they send medics and they have support staff. So they actually help with the COVID testing, paperwork. They help with transporting specimens. I mean, they have been like a godsend in so many ways.
Yes, I remember that now. Yes, thank you, Dawn.
Mm-hmm.
And so you expect that we'll get additional National Guard staff?
Yes, Councilor Bencomo, Don Sanchez. We've been told that the state of New Mexico is supposed to get 100 additional National Guard staff. So we're trying to put our requests in, for our region to have some down in our area.
And specifically medical staff?
Yes, medics, and then usually support staff is what comes.
Okay, great. Well, thanks so much to all of you for all of this information. I just want to make sure that have a really clear and key focus on how strained the system is already for, a city our size, specifically because we do have to take into consideration that we are a hub for a lot of the rural communities around us. And I think that will increase the pressure on the system. So I think it's important that we keep all of that in mind.
Okay, thank you, Councilor Bencomo. And before I get to Councilor Flores, which I think she's back on now, video and audio, and I'm going to say this with all due respect, and I just want you to just think about this, and then we can talk about it later. So I want you to look at two scenarios: 5 individuals at 8 o'clock in the evening talking, not social distancing, and 5 other individuals at 1 o'clock in the morning with mask and talking. Which one would you rather have? And I'll come back to you later on that. Okay, because think about it. What I'm saying is usually these curfews are 9 or 10 o'clock. So what would you, because the other one falls under the curfew. That's why I'm trying to focus on mask enforcement. Because if we go and do it the other way, if they're not doing a mask right now, they're probably not going to do it at their home or in their backyard. So that's why I don't want to. Anyways, I'll come back later. Councilor Flores.
Well, thank you, Mr. Mayor. And as far as the mask wearing at home or any activity at home, I think it'd be difficult to enforce anything
I agree.
at home. And I think that's your point. There's a Fourth Amendment. You'd have to have a search warrant and have, otherwise there'd be a Fourth Amendment violation. But
Councilor, I thought I heard one of the council members talk about parties in the backyard, and I'm like,
yes, it was outdoors. It was outdoors, but masks are definitely and that's what Councilor Abeta Stuvey. So I too had a question about the National Guard, and because I don't know if it was Ms. Sanchez or Dr. Torres who said that they would be coming to the southern part of the state later, but as it turns out, based on Councilor Bencomo's question, they have been here. So one of my questions, and this is something that was brought up early on, especially by Councilor Abeta Stuvey, who has been stressing since March, early March, has been stressing the need to look ahead and look at how we're going to accommodate, because early on, I know in March, when I was talking to my cousins in El Paso, we cut off our monthly gatherings, and they said, well, let's get together in April or May for Lupita's birthday. And I said, no, this is going to be around for about 2 years. It's clear. It's clear. And this was way back, it seems like way back now, early March. So my question to the state of New Mexico and to our local Department of Health, and it's not personal per se to Dr. Sanchez Dr. Torres or Ms. Sanchez, but has the state and the local department or are you working together or cohesively in terms of looking forward at this point, since we're already at that forward point, which was projected, even though there was a slump, and people said, but a lot of people have been saying there's going to be a surge as soon as the cooler weather came in, but it really came in right in the middle of a hot spell that we had. And the other question, so are you looking, for example, I know I had emails, we've all had emails from our constituents suggesting that the convention center be prepped and ready to be used as a hospital. And now Mayor Pro Tem has said this could be another facility for purposes of the COVID crisis. So has the state been looking at that? And now one of you mentioned that we're looking at other places or whatever, other states, I don't know. My notes are really scribbly here, but so every other state around us is going to be doing the same thing. So are we really prepared for this huge surge of people who will need hospitalization, who will need all the ventilators, this, that, and the other. And then we have this shortage of nursing. At least that's what our people are saying. So those two questions go hand in hand. What are you looking at prospectively? You're taking a lot of input from us, but we're not really at the forefront of this. We're in the middle of it, but we're not in the position you are in terms of resource gathering. I hear repeatedly, we don't have the resources to do this, that, and the other. Well, there has to be some sort of resources, otherwise we're all going to perish. So in terms of what is it that the state and the county, what are you doing insofar as looking at this prospectively, and what is our real situation here, prospectively speaking? Has that been looked at? Thank you, Mr. Mayor.
Okay, well, I'm not too sure if I saw a question in there, but let me just jump in real quick on something a little bit similar. So, Dawn, let me ask you this. If hypothetically we had a place for testing, would the state be willing to come down, or can some of our employees there at the city administer these type of tests? And if we were to buy them in bulk, how much would they cost? I don't know if you can answer that.
Mr. Mayor, this is Dawn. Yes, thank you for your question. I appreciate you offering the resource. I think that would be something we could have a conversation around. I mean, we are we are state employees. We're state employees here with the Department of Health. We're all state employees working in our specific counties. We could definitely have a conversation. I mean, with the testing, it's pretty much needing to be in my understanding, well, not necessarily. I guess I was going to say, as far as the test kits that we have right now, it's pretty much, clinical folks being able to administer those tests. That's why it's so critical to have, nurses, someone licensed to be able to do that. That's kind of one of the caveats that we have. Now, with some of these rapid response type equipment, you don't have to have, I think, a medical person for that. But we're not quite at that point.
Okay, let me tell you what I'm thinking is perhaps the clients of some of our food banks that I would think that they would meet they possibly would meet the certain income levels that we could then use money from our Telshore fund to pay for these tests. And then we can just deal with that a lot quicker. And then they can, they could be on site while they're, if they choose to, while they pick up some food and then get tested. So that's where I was going with that. So I'll just let you, think about that, and then perhaps we can circle back either later during the meeting or perhaps on another time here this coming week.
Mr. Mayor, I did have a question out there for Ms. Sanchez or for Dr. Torres regarding prospectively. I mean, where are we going with this? Is there a plan? I mean, bringing in the National Guard, another 100 or so to help out. What about the facilities? Has there been any thought put into that? Once people get tested and they're positive, I mean, I think our hospitals are near capacity. El Paso's at capacity. They're going to start shipping them over here. What? And are they talking to other? Is the state in communication with other states or the federal government as to how to move on this? That's my question. I'd like it answered.
Okay. Yes. One quick thing, David Dalahan. David, do you have an update or remember the facility that we used during the with the asylum seekers, the old armory? Is that still available?
Mr. Mayor, I haven't had any specific discussions. Sorry, David Dolan for the record. I haven't had any specific discussions. I don't think any of us have. As I understand it, it's not being used by the owner, but I could have staff make outreach to them. We have a relationship with that owner. So I'll send staff an email to see if they can get an answer today. I will point out that the convention center is shut down and we do own the building. And it's the parking lot is ours as well. So that's something to keep in mind. Those are probably the two best options available for us. But let me make outreach to real estate staff right now, and I'll see if I can get an answer back to you this morning. If not during the meeting, we can send an email to you later. Thank you.
Okay, great. And getting back with Councilor Flores' question to Dr. Torres or Don.
Yes, so my question, Mr. Mayor and Dr. Torres and Ms. Sanchez is are you talking to other municipalities about prospectively going to be doing? From Las Cruces, you've heard that now from Mr. Dalahan and the mayor that we own the convention center. It's closed down now, so that might be available. The armory where we housed and provided services for the asylum seekers might be available. Are you having those types of conversations with other places in the state of New Mexico?
Thank you, Councilor Flores. This is Salina Torres. I am going to defer this to Amanda from OEM. It seems to me that the information that they collect is then provided to the governor's office and other coordinating entities within state government that then decide how we expand our capacity. So Amanda, do you have anything for this question?
So I'll do my best to answer that. And then Interim Chief Crispin is one of our Unified Area Commanders. He may be able to answer this a little bit better than I. But in looking at facilities right now, we're focusing on isolation of those people who are not able to, who are either probable or positive that are looking for shelter. So maybe they can't isolate within their homes. They can't because they would compromise their family's health, or they don't have a home. They are first responders and need to be away from whatever their situation is, the focus really is on assisting those people. And so there has been some look into those types of facilities. Right now, those are being done within hotels. Chief Crispin, do you have any other information that would be pertinent to this?
Good morning, Mayor, councilors. Eric Crispin, Interim Fire Chief, Doñana County. In regards to what Amanda was saying, on the flip side, we know that the hospitals, which operate independently, have also mentioned that they are having discussions around the same parameters. While we're focusing on protecting first responders and those that we want to safeguard for their families, while we determine if they are in fact COVID positive, awaiting test results, the hospitals have mentioned that they're discussing what do they do with patients who might just need to be sent home with just oxygen, supplemental oxygen. And so they want to determine if there's any facilities that are willing to do some sort of home health care and provide those visits. Obviously, when a patient is in recovery from COVID and is in need of supplemental oxygen, it's evident that a healthcare provider provide assistance, either visits, treatments, whether it be increasing supplemental oxygen or regulating that, maintaining their daily medication intake, so on and so forth. And so the hospitals are doing that on that side. And as Amanda mentioned, we're focusing on our first responder groups so that we can continue to support the residents throughout who are in need of first responder treatment through the 911 system and or other means.
Okay. Thank you, Chief. Councilor Flores, was there anything else?
Well,
you still haven't gotten basically what you want to know is what's the state's plan to help us here to reduce the spread, if any.
Well, and the question too, and I think that Ms. Torres or maybe Dr. Torres said that that as far as the capacity goes, and maybe communication is from the one department and then to another department. And to me, it sounds like the Bureau of Bureaus. It almost sounds like, a horrible comedy here where it's like the right hand doesn't know what the left hand is doing. I don't mean to insult anybody or anything like that, but in this moment of crisis, which is, we're right in the middle of a horrible crisis where anyone can just drop dead, just anyone. And it just seems to me that the state would have implemented some sort of a plan, a cohesive plan. And since we are meeting, we had been meeting early on a weekly basis for a couple of months, I think, or more, and getting these updates. And that's these updates, and we can read about them. And I don't mean to be facetious or anything, but some of these updates are posted and updated on websites. But I just would like to see if there's been any communication between the departments, or if there's been now communication between other states that are affected, because we're all affected now. And for a while there, we were there like a little island unto ourselves where we didn't have this impact. And now we do. We have high numbers. And it seems to me that because of the forecast way back when, that this was going to be around for a long, long time and resurge about this time of the year, that there'd be more planning, there'd be more communication, more conversation again. So I guess the answer is no. Since it hasn't been answered, Mr. Mayor, I would then conclude that there hasn't been any communication at the state level between departments and that they haven't been communicated with other municipalities. I mean, I'd like to know if maybe they've had this conversation with Santa Fe or with Albuquerque.
Yeah.
What are they doing? What are we doing cohesively here?
So, Councilor Flores, I think one of the points is that, you know, we're a centralized Department of Health, so we are in contact with all the regions all the time because it's centralized in Santa Fe, and then we have our regional offices throughout the state. And then, you know, a lot of the data that we present to you is from multiple agencies. So rapid response to, let's say, a business, that's an entirely different bureau within the Department of Health. Surge capacity and hospital monitoring, which Amanda presented on, that's an entirely different bureau. So there is interaction and within the bureaus, within the state. And, you know, as a Department of Health, we've had a pandemic plan even before the pandemic. It's a requirement of a Department of Health to have that. However, this is unprecedented on many, many levels. So I think that, you know, there's a lot of communication in the background that maybe is not completely transparent to everyone, but there are lots of coordinating things happening. And, you know, unfortunately, it may seem like we're not as much ahead of the game as we can be, and maybe that is the situation, but there's a lot of moving pieces and changing, you know, over time. So, I mean, I think if you really want to understand the bigger picture, that would require perhaps reaching out to the governor's office to see how these things are happening, how we're coordinating with other states. You know, the roles that, say, John and myself play within the Department of Health are part of COVID response, but they're not the entire part of it. There's a lot of things happening. So I think that, you know, if you want the bigger picture, that's where I would go. You know, we interact with Public Education Department, long-term and aging, you know, all those agencies are involved in some way or another. But I can understand the frustration and the, you know, the concern. But I don't think that Don or myself or anyone else representing state government on this call could give you the big picture that you want.
And then,
Okay, and that was Dr. Torres speaking.
I'm sorry, I keep forgetting.
That's
So
okay.
we'd have to reach out to the governor. Okay, thank you, Dr. Torres.
Mr. Mayor, can I make a comment to Councilor Flores?
Yes, Don.
This is Don Sanchez. I just want to mention too, I mean, in any emergency, the response is local. So we work very closely, you know, with OEM, with their meetings that they have with all of our law enforcement, first responders, what have you. As Dr. Torres pointed out too, we are working with PED, you know, Public Education Department. We work with Aging and Long-Term Services, working with Environment Department very closely to make sure that we are all playing the role that we've been assigned in this, like Dr. Torres as well mentioned, kind of unprecedented pandemic. So we are definitely collaborating across departments to make sure that we're playing our different parts that we have. For us, for Public Health, Department of Health, our main job is the testing. Our objective is the testing and obviously following up with the results. So that's kind of what our main task is. Environment Department are the ones who are doing all the rapid response and the enforcement. We also partner with them when there's a need for testing for those specific entities. So it is like a puzzle putting together all the different pieces from all the different departments that play a role in this. One thing I did want to mention too, I think I brushed over it very briefly, but the state as well had to submit a COVID vaccine plan to the CDC mid-October. So there is plans in place, you know, a lot of logistics have to be worked out about that, but there's the expectation or the intent of having the first COVID vaccine coming into the state probably end of November, early December. And that is earmarked for our healthcare providers, first responders in that realm. So that's going to be a whole nother activity coming on to hopefully mitigate this whole pandemic that we're in. I think right now the most important thing are those public health orders. What you all are doing with the mask is perfect. The social distancing, if you're sick, stay home. Just those specific behaviors are important to just kind of keep reinforcing as we're going through this together. So I just wanted to make those few comments. Thank you, Mr. Mayor.
Thank you, Don. Okay, so Ifo, you there? Ifo?
I'm here, Mayor.
Okay, so let's do this from what I can tell, and if you need me to do an emergency ordinance, but I think this is well within your purview. So, okay, we've got the mask, we've got the ordinance. I think we need to really step up our PSAs as well as how important it is to wear masks, and I think communications office can deal with that. If you can get your team the one that we assembled with the EOC, the Emergency Operations Command, to work and make sure the hospitals are good, that they got enough beds. And then I think David is going to be checking on the Armory and then also Convention Center, see if that will be our backup in case something was to happen. And then third, we've got the money. If we have to pull it out from the Telshore Fund, if it exceeds your authority, let me know, and then we'll do the emergency proclamation for that, for at least testing of those of our residents who fall under that certain income level that we can abide by the anti-donation clause. And so at least that's I think we've got a few things covered that way. The masks, what happens if the hospitals get over capacity, as well as money for testing for those that don't have access to it, but we can do it this way while they're getting their foods. Hopefully they'll be amenable to that. Good?
Sure.
All right, great. Okay, Councilor Flores, that's a start.
Yeah, it is.
Yeah, okay.
It is a start. Thank you, Mr. Mayor. I just want to say that, well, thank you. That's all I want to say. Thank you.
Councilor Bates-Stuvey?
Yes, thank you, Mayor. I do have quite a few questions for our OEM department. During this time, obviously, I think we have so many agencies, as Dr. Torres said, working together and working in different areas and having to come together. And that's where the OEM becomes very instrumental on making sure that we have that local information, and then they're receiving state information, and we're making sure that that communication is distributed properly, accurately, and that we're advocating as hard for our local communities at these state levels to make sure we get what we need down here in our community, especially during these moments of stress and strain. With that in mind, with the department, it looked like we've had a large focus on making sure that we're taking care of our first responders, and rightfully so, and making sure that we keep those systems in place. Can you talk to me beyond just the medical items? What are our local partners, hospitals, the nursing homes, care facilities? What specific things are they asking for now? And what stresses and strains are they seeing now that they have been asking for through the OEM?
This is Amanda Bowen with the Office of Emergency Management. I'll answer. I'm going to kind of take a long way to get there. Hopefully it doesn't take me a long time to get there, but we do have a unified command structure that we work within, and it has entities working within it from many different entities, from the city police department, the county department, there is the county health and human services, and there is also some coordination pieces back with our state agencies through the Department of Health. Two different sections within our chart are tied back to DOH for some really good coordination between state and local governments. Plus, we have weekly meetings with all of the municipalities and jurisdictions within our purview to be able to distribute that information that you're talking about. So part of our structure is to reach out to vulnerable populations, ensuring that they have the access that they need to information, to testing, and provide those needs back to our structure so that we're addressing those on a regular basis. They've done a lot of coordination with groups like the Community of Hope, and different entities, different businesses, entities that have a specific need that are referred to us. So if you are aware of any kind of specific need, we're happy to reach out in that direction and ensure those are addressed. They've done things like provide just basic information, setting up testing, providing masks, that kind of stuff. We do have a first responder group that we coordinate with to ensure resources are fully available in every entity that we're representing. And our healthcare coalition response addresses the areas that you just spoke to, which is those skilled nursing facilities and long-term care facilities. They've been collecting data from those facilities to be able to track the number of COVID positive patients, or if an outbreak is occurring, And we, as the unified structure, have provided guidance to those kinds of facilities in being able to mitigate infection control and providing fit testing for PPE to ensure that their staff has what they need and knows how to wear it properly. And so we've been really working with a lot of those entities. Right now, what we're hearing, most of the skilled nursing facilities in our area have been hit by what we're calling kind of a response unit that goes in and provides that education to their staff. Most of our long-term care facilities here have received that kind of education. We're tied with the state, what they call ESF 6, which provides us notifications if we need some additional help. Maybe there's a facility we're not aware of that doesn't have that education. And so we're still going out and providing education to those facilities. As far as the hospitals, they seem to have a different need. And like I said, we have weekly calls with the hospitals to ensure that we're responding to the needs that they have. Right now, they've expressed, as Chief Crispin said, a need for some care for those people who have a very low acuity. They maybe are just on oxygen and need very minimal care. So we're working as a team with the hospitals, with the state, and with our local partners to try to address that in tying with home health agencies, tying with our Medical Reserve Corps, which is a volunteer nurse staff that can help monitor for those smaller issues, the less acuity, so we can move those people out of the hospitals. To my understanding, those are their needs at this point, but they're ever changing. And so we're working to make sure that we're all communicating together. Like I said, not only just our local hospitals, but regionally to have a bigger picture look. I know our healthcare coalition representative, her name is Jackie Saldana. She's also in coordination with El Paso frequently. She's weekly, a couple times a week on state calls to really express our needs back to the state so that they know if there are any changes or updates that need to be made.
Thank you for that. One of the other items we touched upon briefly, and you mentioned it, was that of staffing and finding different ways to help provide that type of support. With that in mind, we know Texas was able to find state money to help pay for nurses to come and assist in those hotspot regions. Do we have similar types of programs here in New Mexico to access other funding to pay for nurses to come down beyond that of just activating those special, like the Reserve Corps? But do we have other unique ways of bringing in staffing to our area?
I'm not aware of any specific. I was on a conference call last week where they were looking to explore some more of that. I believe there may have been some at the northern part of the state with that first surge that was utilized. But as of right now, I'm not aware of any medical group who's made a specific ask for that we haven't been able to fill with our local resources. But I've heard little inklings talking about it. So I can't answer specifically a yes or a no. Dawn, you may be able to provide a little bit more guidance there.
Sure. Yes. Thank you, Amanda. Thank you, Councilor Stube. This is Dawn Sanchez, Department of Health. The department did receive a federal grant, the ELC grant, that was for hiring of nurses and medical assistants. So we were slated to have 5 nurses and 10 medical assistants for our region. I will tell you, it's just been a challenge trying to really find applicants and folks willing to, just find the support for that. But we are actively trying to bring on those positions. So again, we do have a little bit of resource. We did have some federal dollars coming to the state to hire that, and those are for nurses and MAs statewide. So we're still working on that. We've been able to hire one who's going to help out in our northern part of our county. But other than that, I think, as Amanda said, trying to fill those gaps as we can. But that's as far as funding specifically for the medical side. That's all that I'm aware of, at least through the Department of Health.
Thank you. And, I recognize that our local systems here, we are strained, we are stressed, we are getting at our capacity levels here. And that's why I think it's so important that we advocate as hard as we can at the state level and let them know that we now need assistance and we need to plan it now before we get 2-3 weeks in and we're beyond capacity. And this is why, you know, we talked about what were the needs down here. And I've been very clear since the start of this that we needed testing here, test processing here for the whole public, not just, you know, tiny specific groups. I think that's great to be able to piecemeal that stuff together. It helps assist, but it doesn't take care of the main support of that. We need to have that testing here because it's part of that process of getting people isolated or getting them treated as efficiently as possible. So we need to have that. Obviously, we need more help with the testing capacities here. And perhaps it is time to really push and talk to the state and say, we need to have more resources here. And we need that help because our systems are already stressed. And we were able to do it with other areas when they felt this strain. We are now getting to these points where we're going to need the same types of assistance. And I just think it's very, very important that we are very clear with those concerns and trying to set things up. You know, it should have probably been done a month ago. When we were told in July that the test processing would be available for everyone here in the community in July, that should have been done. And if not, we need to make sure that we're getting these things. And I find it just system. And I know we need to work very efficiently during this time for all parties. Some of the other questions that I had sent in for your department specifically was just about other types of considerations. We're tracking, as we are a hub center, I know that we received many patients, especially in the first, and I'm going to call it the first surge, many patients from other counties and our areas with different spokes. Now, are we seeing changes in that of those that are coming to us? Are we seeing more community members now? Are we still accepting spokes? So that's one part of it. And then the second part is, even as a hub center, we do not have different types of, I guess, services available here. When we have specific types of traumas, they usually have to get flown out. We don't have things like ECMO machines here, you know, that some patients have had to use, and this is not even just COVID related, but for other things. What are we doing now that areas are getting strained and our patients possibly cannot be transferred out? Are we getting that type of medical equipment here and the staffing that is appropriate to use those medical equipment? Or what is the plan to make sure that we still have those vital services here in more of a rural community?
This is Amanda with the Office of Emergency Management. My area of responsibility isn't with the Healthcare Coalition. I apologize. I don't have the specific answers to your questions. I will find them out and provide them back to you. I do know that as far as accepting from the spoke hospitals, we are accepting the more critical patients at this point, but there's been lots of discussions about when that needs to not be occurring because of our surge. So I will definitely look into those and find an answer for you. I just don't have the specific information that would provide you the acceptable answer you're looking for.
Okay. And that's, you know, I think I've asked these questions from OEM before, and I did send them out in my emails before asking about different types of numbers. So I just find it very concerning. There's a lot of questions that we have and I know it may not be your department, and I understand. With that in mind, with the system of the OEM can you talk to me about right now what's your command structure of your top individuals who would have this information?
Yes, ma'am. Yes, ma'am. So I believe an email went out to you that provided you with a copy of our MAC slides. That has a breakdown of the unified command structure, so you're able to see the full chart and where each individual sits. Right now, our unified area commanders are the Office of Emergency Management, Emergency Management Supervisor Colin Combs, and the interim chief, Eric Crispin.
Okay. Would Mr. Crispin have any of that type of information available?
He may have stepped away. I apologize. Chief Crispin, are you there?
Yes, Mr. Mayor, Councilor Stewie. So in regards to information.
Excuse me, Chief, can you just state your name, please?
Oh, yes, sir. I apologize. Eric Crispin, Interim Fire Chief, Doña Ana County.
Thank you. Go ahead.
Okay, thank you, sir. Councilor Stewie, can you be more specific in the information that you're inquiring to learn about?
Yes, sir. Do you have an answer to what the plan is, since we are a center that doesn't offer specific services for the community? There are certain events, certain types of traumas, certain machines that we don't provide here that we usually transfer out patients. Can you explain right now what that process is, since there is different limitations, and if there are any plans on getting that type of equipment and personnel to run it into our community once there are surge issues?
So, Mayor, Councilor Stewie, you mentioned the word trauma, ma'am. So as I mentioned earlier, that the hospitals are working, there's a partnership between the current Unified Area Command group and the hospitals. We meet telephonically or through telecom weekly to discuss how things are going and what problems or issues they're seeing on their side. Obviously, they are working to ensure that we have beds available, ventilators available, things like that. One thing that is automatic, and we really, for a lack of better terms, take for granted is life comes over everything else. And so when you mention trauma, I'm only assuming that you're talking about a trauma patient. We're going to follow our standard guidelines and protocols, and we're going to care for this patient and either transport them to a local facility, or we will obtain authorization to transport them to a level 1 trauma center. Every facility is required to have a number of trauma beds or an area set aside for these types of situations. I'm not sure if that's where you're headed with your question, if that's what
Yes.
you're looking at.
So that public knows, where are level 1 trauma centers?
So for us, well,
I believe it's just UMC in El Paso is the only one that I'm aware of.
But yes, sir, Mayor, Councilor Stewie. So recognized in this region, UMC is the level 1 trauma center.
In El Paso. Now, given the situation, will they always have availability to accept our trauma patients?
Mayor, Councilor Stewie, I can't answer for the trauma center in El Paso. They don't fall under our guidance or our area command. But my thought is, as I mentioned earlier, life comes first, and so it would be in their best interest to ensure that trauma facilities are available. As I mentioned, even though we're in the middle of this pandemic, I can't attest to how many beds are available or whether or not they have 1 or 2 ortho surgeons or trauma surgeons on hand at any given time. But nonetheless, it would be in their best interest to have those facilities available because emergencies are continuing to happen, trauma-related emergencies, whether we are in a pandemic or not.
Absolutely. And so with that in mind, in case there is ever any sort of differences, since we are crossing state lines, there are other considerations at play. What is the plan, or is there a plan, should that trauma center not be accessible to us? What is the plan to make sure that we're still able to get that level of care for our community?
Mayor, Councilor Stubbe, so I'm not, I think we're going off subject, but I'm going to try to answer it. And so we can go back to what we're dealing with, and that's the pandemic itself. We have protocols in place, ma'am. We call ahead through radio communications to advise them that we're inbound either by air or by ground transport to a receiving facility. For example, if we were to have a trauma patient now, and it's in the best interest to get this trauma patient, in our case here locally, we would probably go to Mountain View because they have ortho on staff. They would make the arrangements to communicate with the level 1 trauma center in our region. We would try and stabilize the patient and either prepare to fly them out to Albuquerque, to UNM, or we would seek other arrangements elsewhere as far as related to trauma. But as I mentioned earlier, Counselor, it is, and I'm not going to speak for the hospitals, that's something that you guys would have to discuss with them, or we could certainly work to have that information provided. But it would be in their best interest to ensure that the trauma facilities have room to accept individuals who are suffering from trauma, even in the middle of a pandemic.
Thank you.
Counselor, if I may interrupt real quick, and this is kind of timely. Ironically, I communicate with Jacob Cintron, the CEO of UMC, and in the event there was a situation, and I know they'll fly them out to another hospital, could be Lubbock or Amarillo. So just want to share that with you. I didn't want to interrupt the chief on it. Go ahead.
Thank you, Mayor. So these questions are very pertinent. And these are the types of questions that when we have staffing shortages during a pandemic, when people are strained, when different hospital systems are strained, unfortunately, these are the types of questions that now get asked when hospitals do have to look at patient transfers. And they do need to look at it because not only are we dealing with the pandemic, but we also are hub centers for these types of issues too. And patients are still going to come to our hospitals and then have to be processed in different types of ways. And so these are the type of questions that are going to come in with or without a pandemic. And with the pandemic, it's only harder to look at what's going to happen. And so that's why I want to make sure that we're having these conversations together, that we're looking at all these things, that all of us are aware at different levels from not only government, but the different coordinating partners, because we all need to be looking at these type of questions because it helps us make good policy decisions. And then we also have preparation and planning, because unfortunately, these are the types of decisions that are going to have to be made in the coming months. And it's going to be very difficult. And the worst type of decisions that hospitals are going to have to make is that on patient care and who gets resources and who doesn't. Who is stable enough to make a transfer, who gets a machine. And those are the types of questions that we have to be asking ourselves now to make sure we're as prepared as possible, because those questions are the hard questions. And so that's why I'm asking those, and I find them to be very relevant. With that in mind, I know we talked about what hospitals are asking about and different resources. Is there anything that the OEM thinks that we need to be considering? And what message do you have for our community?
So
this is Amanda.
Chief, would you like to take that one?
No, go ahead, ma'am. You go ahead and provide info, and then I can follow up.
Well, I was just going to say that OEM is not the only entity that's involved. If you look at our structure, there's entities that are representative of all of the jurisdictions that really play a role in all of this coordination. And I can assure you that at the hospital level and the healthcare coalition level, many of those conversations are taking place and are really in depth. So I know that there are some specific questions that you have that we aren't able to answer at this moment, but I can definitely get you the answers you're looking for, and I can assure you that those conversations are taking place. As far as OEM is concerned, we really are working within this structure to ensure that we provide the best response. So OEM is not the ones who are dictating the response or the direction that we're taking. It's really coming from that unified command structure. I think Chief Crispin would be best probably to speak as far as the unified area commander to that direction.
Thank you, Amanda.
Mayor, Councilors, Eric Crispin, Interim Fire Chief, Doña County, Unified Area Commander. I'm going to go back to what the mayor said earlier. We need you all to assist us in being the champions for encouraging our public to wear masks, exercise social distancing. We have a component of our Unified Area Command known as the JIC, the Joint Information Center. These are comprised of public information officers from public schools, from the county, from the city, and they're all sending out the same message. And that's the message that our partners at Department of Health continue to preach and continue to stress. And that's, wash your hands often, utilize that mask, practice discipline and exercise that social distancing. Avoid the large crowds, so on and so forth, and only go out. Exercise that discipline and only go out if you have to gather food or medications and things like that. And so that's where we need our counselors to be champions for us and assist us and provide that information, because every day when we have these telecon meetings, that's the same message that we're encouraging our Joint Information Center to put out. Reminding folks that we're not doing this because we want to see this. We're doing this because we're trying to ensure that our elderly are safe and our children are safe, so on and so forth. And so, there's a partnership, and we're all trying to send out the same message. And it all goes back to what the mayor mentioned earlier is, please wear your face mask, not for yourself, but for others. And please exercise social distancing for yourself and for others. This isn't something that, we're trying to pick on any one person. We're just trying to ensure that as a community, we stay safe. And so this is one of the things that we're focusing on, is making sure that as a Unified Area Command group, that we're sending out that same message as often as possible. And it's a unified message. It's the same message, and it's supporting the efforts of Department of Health and all the other teams and entities that are part of the structure itself.
Thank you. I really appreciate that message. And I think that's something that the public needs to hear, that this is a matter of public health and safety. This is not political. This is not one person with an idea. And this is certainly not a hoax. And that we need to be working all together in our community and abiding by those health orders so that we can get through this together. And at the other side of this, we have as many of our residents that are able to gather again and take those moments. And so I think it's very important that we make sure to express this unified message among all departments. So I thank you very much for that. And since we're here one last time for Don, would you please remind people that it is flu season. I know that there is going to be another Boo to the Flu event over the weekend. And so I'm not sure if you have that information with you, but just to share, and we can encourage anybody to get a flu shot.
Absolutely, Councillor Struve. This is Dawn Sanchez. Thank you. I was just going to mention that too, because we do need to be mindful that it is flu season as well, and we don't want to overburden our health system any more than we really, need to. So there is the Big Boot of the Flu event happening this Saturday. It will be at Memorial Medical Center from 9 to 12. It's a drive. You just come on up, and they'll give you your immunization there in the car. There's another event also at Burrell College as well on Saturday from 9 to 12. So you're able to come there too. It's free of charge. Just go ahead and show up there. And then at our health office too, we are providing flu shots, on a daily basis too. You just need to, if you want to have an appointment, you just go ahead and register through the same COVID test registration application that you do for the COVID test. But just call our office at any time. We can help you with that as well.
Thank you very much, Sean. And thank you, Mayor.
Thank you, Councillor. Any other council members have any questions? So I guess this question I'm going to ask, well, let me just run by my colleagues here. If we could theoretically send masks to all of our residents in the city, be supportive of that? Yeah, so Delilah, are you there? So I was thinking.
Yes, sir, I'm here.
Yeah,
I had to unmute and take off my mask.
Okay, no problem. So I was thinking that we used to, I don't remember the numbers, but they're probably in the ballpark of about 33,000 customers of your utilities. And in that ballpark, and I'm thinking if we were to have that database and send, say, 5 masks to each of those households, we at least cover, I think, at least 1 per household and then some, because we also have to consider the possibility that there are some of our residents, or many of them, may not even have access to a mask. And I think, and I'll double check with Jennifer, but I think that this would actually qualify under the anti-donation clause, that if we give free masks out, distribute them this way, and it would probably cost us about $50,000, $60,000, but it'll be for the good of the public, because now there are masks, and hopefully could greatly reduce the spread. Because if hypothetically 20% of our citizens our residents don't have masks, and now we've given them something, it's better than that. It's better, it's a good start. Is that something that we could have access to your database if needed? Delilah?
And Mayor, I'm sorry. Yes, we have approximately, if we look at within city limits only, we have approximately 35,000 to 38,000 customers, but we can search our database and we can outline city limits, and we do have the information available.
Okay, so.
Mr. Mayor?
Yes, David?
Would we only want to do that to our residences, our residential service address, not our commercial? Because that makes a difference, because we serve both commercial and residential properties.
Well, I was looking more, I think commercial businesses are a lot easier to have masks. I'm sure there's some that don't.
I was just trying, Mr. Mayor, I was just trying to clarify, that's only to residential properties.
Yeah, that's what I was thinking. I mean, if council wants to do both, or if they even want to do it at all, but I think it'd be, and let me just get clarification from Jennifer if that's an allowable expense. But I would think that it hopefully would. Jennifer, do you want to comment on whether or not we could do something like that?
Thank you, Mayor and Council. Because it's a public health issue, and because this is addressing an immediate emergency public health issue, I think it would be allowable under anti-donation. I also would ask that you consider widening to the broader community. So there are a lot of people who will live in apartments that won't be resident. They won't have accounts with and also other rental properties. So we probably want to open it up to them as well.
Good point. I like that. So that one is kind of immediate. We could take them to apartment complexes, and we need to just really be aggressive and just do our best to get masks out to everybody. And I think that would greatly have huge impacts on compliance to wearing face masks. Thank you, Jennifer. Thanks for that.
Mr. Mayor.
Mr. Mayor,
Go ahead, David, and then I'll go to Councilor Flores.
I did want to remind you of the community mask up events that we have every month through the Quality of Life Department. They are very successful, and we have them scheduled through November and December at this point. So we're not doing without. So there are other means to the community as available as well. Just
oh no, I think those are great, and I want to thank Councilors Bencomo, Gandara, Bita Stuvi, and others that have done this to help that out, and even Sheriff Stewart. But I think you know, since Jennifer gave us the green light, I think, and I agree that why not? You know what? Let's just do it. I mean, we need to be aggressive on this. I mean, I'm not saying that staff has to, you know, get this turned out by next week, but if they can work on it in the next week or two, I mean, it's like you just have to, you know, we'll have to buy a lot of, we'll buy those little envelopes. The reason why I know is because I've actually done this. I've sent out to my agents. I send out 5 masks, and they're in those small little manila envelopes, and they actually still, they're so light, they cover one postage stamp, but I'm sure we can do a bulk mail. I mean, there's just ways to get it done. And since we have the database, we can produce the labels, we can do a lot of things. I know we can get it done. Thank you for that, David. Mayor Pro Tem, and then Councilor Bencomo.
Mayor, thank you so much for that. I think that's going to be very helpful. Yesterday, I was in a store grabbing something really quickly later in the evening, and someone walked in with her shirt above her mouth and nose and saying, "Do you have a mask?" Right? And I wished I had, you know, the bunches that I do have available to give it to her, but I think there are still some folks that just don't, you know, she wanted to do some very quick shopping, and she says, "I'm not used to wearing a mask." So I think you're right that there are some folks that don't have access to it for whatever reason. She said, "I walked a great distance to get, you know, here." And I felt so badly for her. So I think that's going to take care of a lot of folks, hopefully. But as we heard from our DOH partners, people are mass gathering and not wearing their mask. And I think that goes hand in hand. I think we need to increase, like you've indicated, the public awareness campaigns, talking to people about the mass gatherings. They shouldn't be doing it. They should really adhere to the governor's order. So if we can do anything, your emergency proclamations include no mass gathering and bump up the enforcement, I think we're going to be better for it. I know you don't want to do curfews. I get that loud and clear, and neither do I. But I just don't see any other option. People, and I know you said, oh, do we want the 5 people with a mask, or at the different hours and whatever. Honestly, I think the bottom line is people just have to take the personal responsibility and not gather, period. And if they do, like Interim Chief Crespin said, that they're using their mask, they're socially distancing, washing their hands on a regular basis. So hopefully with these things, people will listen and abide by. But the other thing, Mayor, is I would really recommend, and I want to request from staff, that when we have these meetings, that we come prepared with the information, especially when some counselors are giving out, questions, so that people are prepared. I want to see MAC reports weekly. It's been a very long time since we've gotten received anything. I think that should just be a given, that is given to us regularly, that we know that these conversations are being had. We don't sit on those those weekly or daily meetings that you have in the mornings. We don't sit, we don't hear from our folks regularly. We really rely on those. And so like I read those MAC reports thoroughly. I also don't want to continue to hear that our partners that are having these conversations are being a barrier to receiving resources, to include oxygen and those kinds of things. We have to think creatively about these and these things. And I'm hearing from hospitals and different organizations that some of the folks that are supposed to be providing emergency management services are providing more barriers than they are assisting. And I don't want to have to say this out loud, but I feel like I have to. I feel like when I'm listening to all these questions and people are answering, that I feel that there's some frustration about the questions that are being asked. And I want people to understand that we're responsible for our community, 100,000 plus people. And we haven't met in quite a while. So for me to feel like there's some frustration with the questions that are being asked, or that there's comments like we're gearing up, we're veering off subject, when a lot of this is of great concern to all of us. And so I want the hospital at these the hospital representation at these meetings, so we hear from nurses and doctors firsthand how overwhelmed that they are. This is the only opportunity that we hear from them publicly, and I'd like to just make sure that they're here present and that we're hearing from them, and that that we know that these conversations are being had. There's some new players to this meeting for lots of reasons, and I appreciate everybody that has taken the time. But again, I think, please, let's all be patient with one another. We're in this together. We truly, all of us care about our community, and we don't want to see these services overwhelmed any more than they are. So thank you, Mayor.
Mm-hmm. Thank you, Mayor Pro Tem. Forget to Councilor Bencomo. I just want to, I failed to mention, I reached out to both CEOs of the hospital, Mr. Harris and Derek, and they both said they're fine. They have beds. So I just wanted to relay that, and they're good to go. So, Councilor Bencomo and then Councilor Flores.
Thanks, Mayor. And I almost don't want to go after what Mayor Pro Tem said, because that was so wonderful and beautiful. And I think, thank you for that, Mayor Pro Tem. I think you're right. We have to remember that the enemy here is the virus, and that's the ultimate goal is to minimize the spread of it and minimize the number of New Mexicans and Las Cruces that are very negatively impacted by this virus. So I think that's an important thing to keep in mind for sure. Earlier, I think we want to have obviously high standards, and we want to ask for all these things from the state, which I think is important. I keep thinking though, what are we doing? What role is the city of Las Cruces playing in ensuring that we're curbing? It's not just like, I don't think we can continue to just sort of stand behind the state and wait till the state does this or wait till the state does that. I think we also have to take more responsibility and more of a leadership in the way that we want to curb the surge here in our very own community. Nobody knows our community like we do. And so I want to make sure that we're also asking ourselves, what are we doing in this moment? Mayor, I think I love your idea of sending masks out. I think at the end of the day, we don't know people's situations and why they may or may not have a mask yet. I also want to note, though, that I don't think that's the problem. The problem is the people that don't want to wear a mask, not the people that don't have one to wear. The majority of the problem are from the folks who don't want to wear one, who don't believe that this is serious, who continue to break the rules going into stores or continue to gather in groups larger than 10 because they don't think it's a big deal. Like, that's where the problem is. And I think that's why I'm pushing so hard for enforcement. And Mayor, I love your hypotheticals. You always bring them and I love them. But I will say, Mayor, that what's not a hypothetical is the number of cases we're seeing on a daily basis come out of Doña Ana County. That's not a hypothetical, and that's serious, and it's only going to get worse as we head into flu season. So, I just want us to keep asking ourselves, what are we doing in response to the surge? So thank you.
Thank you, Councilman Como. I appreciate that. And I'm smiling a little bit because for a split second now, I think you now understand where law enforcement comes from, why they get a little frustrated with residents, when they're breaking the law. It's like, you can't be doing that. And what you got to do, you got to do the enforcement. So anyways, thank you for that. Councilor Flores.
Thank you, Mr. Mayor. No, everything that Councilor Bencomo or Mayor Pro Tem Gandara both have covered my points. I think it's just empirical data that we might have about people who don't want to wear masks because we haven't done a survey. But one may deduce that yes, it's those who don't want to. But I do think it's an excellent idea that we should send those masks out. I know I received some from my healthcare provider, and it's nice. You just throw them in the car and you have them there or by your door when you come in and come out. So the more the merrier. Thank you, Mr. Mayor. And that's all.
Okay, Mayor Pro Tem, did you have another question, or did you forget to put your hand down?
Sorry, Mayor, I forgot to put my hand down.
Okay, all right. So, Ifo, if you can start looking at that, you may need for me to do that emergency proclamation to give you the money, because this may get kind of, I'm estimating it's around 70,000 to do the mask, including the postage, the envelope, and the actual mask themselves, and the labels, or however you do it. So, Delilah, you have a comment?
Mayor, we've got staff. We'll start working on our side too to see if we can do something as either a bill insert or with a billing cycle tag on.
Oh, great. Oh, you mean put the mask in there?
Yes, sir. Or do a alternate billing cycle out so we can have it go one after another and take advantage of our bulk mailing.
Okay, great. Oh, I'm sure you're going to charge us, right?
Of course. We're utilities.
Yeah, well, I just want to make sure. There's been a new change of command here. I just want to know if I know what you have.
Jorge trained me well.
Yeah. Okay. Okay. So, and I think so Ifo, yeah. If you need anything, you work up the prices, and because otherwise it's going to take 2 weeks to get that. But if you need me, just let me know about that, and then as well as the other issues. But I think we've had a very productive meeting today. I appreciate everyone's comments and everyone who joined us, and thank you, Amanda, Don, and Dr. Torres. Thank you for that, and Chief Eric Crispin. Okay, I guess if there's nothing further, entertain a motion to adjourn.
So moved.
Second.
Oh, Councilor Sword. A motion by Councilor Flores, second by Councilor Sword to adjourn. All those in favor? Oh, that's right. Better. Christine, you want to call the roll, please?
Yes. This is on the motion to adjourn the special meeting. Councilor Beta Stevie?
Yes.
Councilor Vasquez?
Yes.
Councilor Bencomo?
Yes.
Councilor Sorg?
Yes.
Councilor Flores?
Yes.
Councilor Gandara?
Yes.
Mayor?
Yes. Okay, you all. See you all later. Have a safe weekend.
Thank you. You too.
Okay, bye-bye.